Ladies and gentlemen, on behalf of Thalassemia India, myself, the President Deepak Chopra, I welcome you all on this 28th International Thalassemia Day. This particular program is unique in its own form. How and why it is unique, I shall come a bit later. But before we proceed, with a very heavy heart, I have to say that since we last met, we lost a few of our very bright minds. To name one who was a member of our executive, Shigangi Amrit, and many others like her. So can I request all of you, wherever you are, I know you are all seated in different parts of the world, if you could just close your eyes and let's say in condolence and remembrance, and I will repeat the word, you would like to say it with me, Om Shanti. Life is a bag of a mixture. While we have sorrows, we also have happinesses. So since we last met, we also have had many young bright minds who are our thalassemics, who have achieved many a milestone. Some have got married, some have achieved in their own personal lives, professional lives, many things which can be talked about. But I would request you all to do the thumbs up, to congratulate all those who got married or those who achieved something in their life. Really well done. Now coming to as to why this conference or webinar or seminar, different names that you can call it, is unique, is because it's a hybrid. A hybrid where few are joined in physically and a lot are on the virtual mode. This virtual mode has been taught to us, or we have all become now slaves to this virtual mode since this pandemic. A common man in this pandemic of 2 years had many challenges to face. Now, if a common man had many challenges to face, you imagine what would have been the life of these thalassemics. I know many of you have been really working on 24/7 to be the lifeline, to be the support line for these thalassemics. Nevertheless, we learned a lot because of your participation, your commitment during these 2 years of pandemic, especially when we talk about support to the thalassemics. If you all have a look at the theme of this conference, it says, be aware, share, and care. The theme itself was very carefully chosen, and the caption gives the complete message. What we need actually is to amplify on all these three words of aware, share, and care. When we talk of aware, we basically talk of awareness. Yes, there has been a lot of ground covered when I said that this is the 28th year of the International Thalassemia Day being observed or celebrated, because in the initial years, I remember we only used to observe. We never celebrated. But yes, as we have covered a lot of ground, awareness has gone round. It has spread. But still, while the awareness has been spreading, we still have been having births of thalassemic children, which means that there is a gap between the awareness and prevention. So, I would say that if a big takeaway message from this conference, with the support of all those who are either here today present physically or will be joining a bit later, because the program has been divided into two parts. The others who are at different places, attending virtually, contributing virtually, if we could somehow or the other draw up a plan, a program, a committed format where the gap of awareness and prevention is absolutely matched, to see to it that we have a zero birth of a thalassemic. Because if the awareness is going to spread to every nook and corner, fully supported by a prevention program, I see no reason as to why, if other world countries could achieve a zero birth, India should lag behind. I now pick up the second word, share. The share also has a huge message behind it. Now, this message of word share is that we have to have more and more screening of thalassemic traits being done, for which technology partners are willing to support us. I recall the past journey, the past years in our journey, where the technology was not available, or if it was available, it was too expensive. But today, when technology partners are willing to join hands with us, let us share and see to it that more and more screening camps are held, fully supported by the government. It's a matter of privilege and pride for Thalassemia India to say that this particular conference today is being attended, or there are participants or the various stakeholders for this blood disorder, thalassemia, have come in full capacity. We have representation from the captains of Indian industry. I don't call it Confederation of Indian Industry, I call it as captains of Indian industry. We have representatives from the captains of Indian industry. We have representatives from the World Health Organization. We have representatives from our own TIF. We have representatives from various technology partners who have programs for either screening or for the Safe Blood campaign, as we have taken up for nucleic acid tested blood. We have representatives who are, I don't know whether they have come in or they are joined in virtually, from the Government of India Department or the Ministry of Health, through the NHM, the National Health Mission. We have representatives from yet another ministry of the Government of India, that is the Tribal Ministry. Now imagine, one side is the Health Ministry, the other side is the Tribal Ministry. We have representatives from various state governments or various states. We have a representative from Odisha, we have a representative from Rajasthan, we have a representative from West Bengal also, if I'm not mistaken. Of course, how can I ever forget our hometown, Delhi, We have representatives from the government of Delhi. Now imagine if you have people from industry, you have people from government, not only one ministry but two ministries, you have people from various state governments. So the only pillar which is missing to my mind, or which I see with my naked eyes, not present over here, is one pillar, and that is the media. My request is to each one of you, in your own capacity, if you could impress upon that unless and until the media also understands that this is a cause which has to be brought, because if we talk about aware and share, so we need them in both the segments of awareness as well as the sharing part. Another matter of pride is that it is for the first time I have been associated with Thalassemia India. Some people call me as the father figure of this organization, maybe because I'm the oldest. Never before has International Thalassemia Day been observed or celebrated in different parts of the country, not on one particular day, which is the 8th. We could not celebrate it tomorrow, 8th being a Sunday, because we had representatives from the government. So most of the people said that we will not be able to join you on a Sunday. So we had to bring it to the 7th. So look at it, that if we have participation from all these segments, then achieving the goal is not difficult. It is not impossible. So what is needed? Needed is synergy between all of them. Now this synergy can only come in if we have a template of the best practices available, be it in blood donation, be it in the testing, that whether it is a safe blood being given, be it in the screening, or be it in the ultimate, the transfusion, care, treatment. Now here, I would like to stress a little more. The back end, please cue me if I have gone beyond the time. I think with the type of advancement, with the type of breakthroughs on the medical front, we now definitely need a center of excellence for transfusion. Now this is not required only in one place. Why shouldn't it be that the child or the thalassemic who has to go for transfusion in Gurgaon, in Agra, in Lucknow, in Odisha, in Rajasthan, be it Jaipur, be it Jodhpur, every single center of transfusion should be a center of excellence. Now that can only happen if all those who are today participants, as I listed earlier, government is a participant, WHO is a participant, captains of Indian industry are a participant, our medical fraternity, all the doctors, nurses, I have no words of appreciation and gratitude for them as to how much they do for us or for these children. The only thing required is that we must be able to give them a center of excellence where, why should it not be that a thalassemic just enters on the day he or she has to go in for transfusion, goes in knowing fully well that I'm going for a prick, but I'm going to come out with a kick. So let it be that he enters for a prick and he goes out with a kick. Give him or her that feel that, well, this has been a place I have to come here every fortnight or every 3 weeks or a month later, but still it should be that, well, he or she should get the feeling that, well, everything is going to be as per international practices. I know that when the official vote of thanks is going to be said by a colleague of mine, all words of appreciation, gratitude will be said for each one who has contributed in either participation physically, personally, or virtually, or those who have supported, all our friends, our donors, our supporters, be it those who have been regularly giving the main lifeline, that is blood for these children, the Indian Red Cross Society Blood Bank. Each one, I'm sure, at the vote of thanks will be mentioned, but I have no words to thank those who have actually participated, be it virtually or physically. Thank you all, ladies and gentlemen. I'm very hopeful that at the end of today's seminar or conference or webinar, whatever one may call, we will go out on a positive note that when we meet next year to celebrate in a big way, not in a hybrid way, I hope the pandemic would have ended. We are, all those who are working 24/7 in the medical field will get a sigh of relief. We should be together face to face in a happy mode, and we should be able to say that yes, whatever we had committed or whatever we had thought on the International Day of Thalassemia in 2022, we have been able to achieve and deliver in 2023. With these words, I inaugurate or let this flow of this conference go on, and I now request the moderator for the next part of this program, our very able Dr. Amita Mahajan, to please take over from me. Thank you very much, ladies and gentlemen.
A very good morning to each and every one of you, and also to, I think, more than 180 people who have joined us online, representing thalassemia societies across the country and representing thalassemia patients and parents across the country. So once again, it truly fills our heart with warmth and gratitude to have each and every one of you. हम सब thalassemia से बहुत सालों से जुड़े हुए हैं, but this year truly feels there is a new zest, new enthusiasm. हवा का रुख ही कुछ अलग है. And for that, we thank each and every one of you. And on behalf of Thalassemics India, I'd just like to say that Mrs. Tuli and Mr. Chopra started this journey alone, maybe with a handful of people. चले थे, मैं चला, अकेले ही चला था जानिबे मंजिल, मगर लोग साथ आते गए और कारवां बन गया. So this कारवां is truly now ready to take us to the transformation that we've been waiting to see. And to begin the session today, I'd like to invite Dr. Andrula. Is she online? Can I have her introduction slide, please? Dr. Andrula is the Executive Director of Thalassemics International Federation, and she's been a long-standing friend, mentor, and guide to Thalassemics India, and really to thalassemic societies globally. Today, she will be talking on time for action. So as you will judge, that there is a new zest, new enthusiasm, and new positivity that we truly now are ready for change. And it is exemplified by the presence of government officials here, policy makers, doctors, nurses, like Mr. Chopra said, all the stakeholders under one umbrella, all desperate for change that we've been wanting. So she will talk on time for action, create change, and help address existing challenges for patients living in developing countries. Dr. Andrula, their example of what they've done in Cyprus is being truly inspirational, and I think that is a model that almost every country, every society wants to follow. But equally, they have been engaged with developing countries which have different challenges, which are sometimes very difficult to surmount. And throughout this journey, she has been our guide, and we look forward to hearing from her today. Dr. Andrula, over to you.
Thank you very much, Dr. Amida. Mr. President, eminent speakers, distinguished audience, it is my pleasure and real honor to participate in this meeting. And I pay, first and above all, my condolences to those whom we lost, as the President have already mentioned. Congratulations to all those who have achieved and are trying to achieve in future other milestones. And this is indeed a day of memory for those who have lost on the way. And for those, honoring those researchers who have brought us today to be able to speak about changes and improvements. Now, can I change the... Yes, I think we are okay with, in the interest of time, we'll be just briefly touching on the impact of providing optimal control in contributing to sustainability of health and social care systems. What the Global Thalassemia Review as a deliverable with World Health Organization's work has given and has demonstrated and has confirmed what is happening around the world with regard to prevention and care. And we shall try in a couple of slides to actually see how we can address these huge unmet needs and inequalities around the world. Oh, why is it changing? Sorry. So we are talking about thalassemia, ladies and gentlemen. We are talking about a disease for which there is ample information, resolutions, guidelines, recommendations by World Health Organization for decades now. And we're talking about a disease for which there is ample documentation of how to appropriately and effectively prevent and treat. And we can share best examples and best practices, as Dr. Amita has already changed, from countries who've had successful control programs and have shown increased survival, improvement of the quality of health of patients, decrease of the annual affected births, and decrease of the annual deaths of individuals with these diseases, reflected through very importantly demonstrating age distributions across the world. So we're talking about a disease that optimal health and social care plus effective prevention result in the increased patient survival, in the increased integration of our individuals with these diseases into the society, which is what the governments are trying to achieve: integration and providing health and care to patients to be productive citizens. We're all aware of the necessary services for optimal care: transfusion chelation, iron load control, multidisciplinary care, and social and financial support to the patients. But very importantly, all these components can only be effective if they are integrated within a national strategy in the national healthcare system that is based on universal health coverage and the existence of registries. There is no way such a chronic disease can be effectively controlled if it's not within a national healthcare system, nationally coordinated and funded. And we're talking about a disease that started with very little to no knowledge in 1925, and we have gone to 2022 talking about optimal, almost state-of-the-art clinical management, social care, and cure. We're seeing pictures at the end of this arrow that are individuals with thalassemia that have actually been cured, and they're telling our stories. All the bricks down are the countries around the world, and different countries are at different stages of provision of quality care, health and social. So there is a complete and very significant heterogeneity in the extent and quality of care provided to these patients. Truly unmet needs are emerging and have emerged all over the world. And we all know why. Poor economies, health priorities, other health priorities, political, environmental, physical upheavals, all contribute to weak medical, public health and social infrastructures, which are contributing to the ineffectiveness of providing patients. And on the left, we see a slide where in 40 countries, it took 27 years, for example, to pass on important public health interventions, including hepatitis B. So this is important in understanding why unmet needs are emerging. And in the work of TIF with World Health Organization, one of the most important deliverables between 2018 and 2021 has been the Global Thalassemia Review 2021, in trying to capture the patient's perspective through as reliable as possible information, through reports and with the support of healthcare professionals and competent authorities. This review tried to cover all aspects of care, from blood chelation, social, multidisciplinary, but also included the aspect of prevention, estimation of the cost of the disease burden, and the role and contribution of the active patient engagement. So what this report showed as a result, which in the interest of time I cannot go comprehensively, is that there are huge unmet needs, many and multiple around the globe, leading to huge inequalities in more than 80 countries of the world. And in more than 75% of patients do not have access to appropriate care. And a snapshot of the global scene, we focus on the low and medium income countries, for example. We see that in the case of blood safety, blood adequacy, which is an important element, the cornerstone of the management, the life, survival and quality of life of these patients, 60% experience frequent postponement because of the inadequacy of blood. Their transfused hemoglobin levels well below what is recommended by international experts. Nearly 100% have never heard and have never reported to hemovigilance programs, which are the programs that will bring up the corrective actions and will guide the government to more tailored policies. And nearly 90% are not aware of the processing that their blood they're receiving has actually gone through. And what is very important is that all these are happening in the presence of important resolutions on blood safety by World Health Organization on all aspects of blood safety and adequacy. And another amazing and very impressive and sad story is that there are no reliable reports existing on transfusion-related adverse events reactions that would also give us the opportunity to tailor policies and actions. And the same happens with the effectiveness of iron chelation. Iron control, which is iron load measurement and chelation, is also showing very red spots on this table, just explaining the ineffectiveness that is happening in more than 60% of the countries, in more than 80% of the patients globally in low and medium income countries. In fact, less than 10% of the patients of the global patient community in these countries are actually receiving what we call appropriate and effective and safe chelation. More specifically, in the Southeast Asian region, it is a poorer situation, with many countries still relying on replacement donation. There is a problem in collecting adequate blood for the patients, in giving safe and appropriate iron load monitoring with quality control, and accessing drugs that are safe and effective and scientifically documented that they are safe and effective. And the access of patients to these services has a cost, because it relies on healthcare systems that are based on out-of-pocket practices. And what is amazing and impressive, and we need to fight for this, is that less than 1% of the countries are actually able to give services to the patients, multidisciplinary, structured and well-trained multidisciplinary and access to reference centers. The same story is for the existence and adherence to national guidelines that are based on international standards. There is nearly 100% absence of national registries which is an imperative element in actually identifying what you have, what is happening in a country, and helping governments to tailor their policies. And prevention programs, 90% of the countries they do not have a nationally coordinated prevention policy. They have regional, they have central related, rural related, regional related, but no national coordinated programs. And as Dr. Amida has mentioned, only a nationally coordinated prevention program with all the elements of awareness, screening, counseling, prenatal diagnosis, and all those elements can actually bring successful results. And national thalassemia associations are existent. That's the good percentage of the countries that have the patient's voice, but still need strengthening and more active participation, as in the case we see here with the Thalassemics India. Now, with India, I have to mention this, although I'm taking the time, but India has focused considerable attention through the years on hemoglobin disorders. There is a heavy political commitment through the years, extensive research and scientific publishing from Indian researchers and academics. So there has always been a heavy political and government commitment. There has always been an active patient engagement, interested and involved healthcare professionals. I have lived this throughout my professional life at TIV, and therefore I am confident that although things need to be done, and there are still gaps to be done, India is a country that will form the example of a large heterogeneous population that will find the way to actually improve and strengthen the control, both the prevention and the management. It has already anticipated and published that prevention of thalassemia, if not effective, will have a total of so many hundreds of thousands of individuals with this disease by 2026. It will cost so many million units of total treatment, annual blood supply, and will take 20% nearly of the Indian national health budget. So there is a way that this will improve, because there is the commitment and there is the activity, and there are already a lot of base to build on. How do we meet these unmet needs? How do we fill the gaps? But already information is available. Already the nations have signed in 2015 a universal call to action, the Sustainable Development Goals by 2030. And some of these elements that we have all signed are to address poverty, are to reduce inequalities. But amongst this is the good health and well-being, the decent health, and the universal coverage of the patients, which is an integral part of achieving Sustainable Development Goal number 3. So there we have a commitment as governments, all of us, because what is important is that we should all focus on reducing the pain, the unreliability and the uncertainty that the individuals with such chronic genetic diseases are living, the high rates of morbidity and early death. It's important. This is the job of the government. This is why we are here as patient organizations, and World Health Organization and United Nations have given us a lot of information. And for us as TIV, knowing and experiencing at the grassroots of every country what is happening, for us, number one is transformation of health and social services to universal coverage. No chronic patient, particularly hereditary diseases, which start from day zero to the long days, I hope, and the long years that we will give them, could have effective treatment and control in and out of patient practice system. Therefore, transformation to universal health coverage is the best and number one. So, and governments need to realize that they don't need huge budget to actually address such a disease. There's so much going on, and there is so much they can do with synergies, and realizing that if not addressing effectively the medical, public, social, and economic repercussions of these disorders that contribute significantly, if not effectively control, to the resilience and sustainability of the whole health, social, and care systems. So if governments realize that by effectively controlling, they are actually controlling the resilience and sustainability of their health and social care systems, they will immediately have a heavy and deep commitment to actually address the gaps. But in order to address the gaps, they also need some help. They need national registries to know what is happening, to know where they go, to tailor their policies, to have reliable, accurate numbers and figures, and synergies in order to share experience. Not only the experience of countries like Cyprus, which are small, homogeneous, but we have given together with Italy and Greece those elements that are necessary. But countries like India, with heterogeneity and huge population, have to build on this, but also tailor according to their challenges and their competencies, share experience and expertise with the countries around the region as the European Reference Network example, because Europe has done a new policy called ERNs, European Reference Networks, and these share expertise and cases, and this could also be happening in such a region as Southeast Asia. So, but World Health Organization is our strongest ally. There are a huge number of resolutions on disease-specific, on genetic diseases, on blood safety, pharmacovigilance, migrants' health, non-communicable diseases, patient safety, essential drugs, viral hepatitis. We have the guidance and the elements, and therefore, this is how we need to work to complete our own gaps. And the last but not least, and this is my last, I think, slide, is the introduction and strengthening of the use of generic drugs. We are all aware that through the decades, the introduction of generic drugs has helped significantly the increase of access of patients to essential drugs. And we see this is the global map of the use of generic drugs. India has one of the biggest use of generic drugs, 97%, our 2021 table shows. And everyone is trying to reach this height. But it is important to secure safety and effectiveness of this drug. It's no use just using generic drug to increase access. We have to see what are the national authorization and national policies and perhaps studies amongst these patients that would secure safety and effectiveness of drug. We need published data on such a very important topic. And last but not least, do not forget the important role of the patient engagement. This is the voice and the perspective that will help us all, governments, competent authorities, stakeholders, to actually recognize what they need, what's the value of the policies they give. And the best example in this particular audience, of course, is Children Thalassemics India. And thank you very much for giving me this opportunity to express TIF's perspective on how we feel we should move on. Thank you.
Thank you so much, Dr. Andrea, for taking us through the journey of different countries, including India, in this fight. And as most of you would have seen, that we've achieved a lot in the last few decades. That most patients in India now have access to treatment. पर सितारों से जहाँ आगे और भी है, इश्क के इम्तिहान और भी हैं. So today, if we have achieved something, it has only heightened our aspirations and the aspirations of our patients. And the two challenges that I see is one, to meet the aspirations of our patients, that they not only just get the basic treatment, but they get what we would call as ideal treatment. And second, to set an effective prevention program in place, which is not only ideal, but it is the need of the hour. It is the only cost-effective way for India to manage the problem or tackle the problem of thalassemia. And that will need a big boost from policymakers. And for the next talk, we have Dr. Shabnam Singh, who who's the Principal Advisor, Health Policy Confederation of Indian Industry, to talk on the role of strategic partnerships in prevention and care of thalassemia. We welcome Dr. Shabnam Singh.
Not to, if I can have that, maybe I'll just sit down. Right. So, my congratulations to the Thalassemia Society, and sincere thanks for inviting CII here, who I represent for this particular piece. Hearing Mr. Chopra, as well as Angela for the second time, it brought forth to my mind as to how we have changed, we have evolved in looking at the entire system of delivery of healthcare. So if we go back in history and we see how was healthcare delivered, it was episodic. It was an intervention to take care of an acute problem. There was nothing in the delivery which looked at it from a long-term perspective. We come to today, and now we are looking at healthcare delivery from a lens or a prism of not episodic, one-time interventions, but from a lens of a continuum. And whenever you look at anything from the lens of a continuum, you realize that there cannot be a single actor in play. And that is what I think repeatedly Mr. Chopra brought out in his inaugural address. You cannot have this if you have limited number of actors. This requires participative effort to develop an ecosystem at the center of which is the individual. So in the late 80s and early 90s in healthcare delivery, you approached healthcare and we coined a word, patient-centric, right? So that now has gone to a person-centric approach. Now when you look at an individual, you have to see what surrounds this individual. And what surrounds the individual is the community. And it is with this lens, and I'll give you a brief background of CII. I'll try and keep to time. If I go overboard, please do correct me. That CII represents approximately 10,000 large corporates. Attached to this 10,000 large corporates, we have approximately 3 lakh small and medium enterprises who are attached with us. So when we started, and I have been with CII for the last 21 years, we started the Healthcare Council looking at it predictably from a healthcare delivery perspective. Then we went into medical technology, diagnostics, pharma, so on and so forth. And of course, most importantly, quality. So it gave birth to the NABH program, which all of you are very familiar with. But in around 2017 and 18, we realized that we are jogging at pretty much the same place like Brownian movement. And if the SDGs, as mentioned earlier, were to be achieved, this approach is not going to solve for the problem. And thereby, we put together a council for public health. And in the Public Health Council, we requested Dr. Randeep Guleria to chair it for us. Now, what has evolved in the last 3 years, and your piece sits right in the middle. Once we put this together, and this was pre-COVID, we were repeatedly approached by exactly the same kind of situation that is with the thalassemics. low awareness, inability to reach out. How do you hook the federal system that the national and the states speak to each other? And then we realized that there are a plethora of excellent work done both at the central level as well as the state level. And the kind of mind that is there and the technical expertise in the public sector, it's absolutely astounding. However, there was an inbuilt mistrust between the public sector and the private sector. Now, in the private sector, the unfortunate truth is that about 80% of outpatient work is done in the private sector. And in the inpatient work, about 45 to 50% was done in the private sector. So our task was cut out for us. The platform we needed to make was different. And that is where the birth of the ecosystem platform arose. And in the ecosystem, we put community in the center. We put community in the center and decided that we have to work with the community, come up with a template, test that template, and then have it adopted and scaled. And I'll give you an example so that you can then relate to what we are doing for thalassemia. So as you know, tuberculosis is the oldest disease mankind has known. It has been there from day dot since mankind. Yet, despite the fact that we've had stupendous success with the BCG vaccination, it still exists. And the only way to crack this, we figured, was to enable this ecosystem. So along with Global Health and the Ministry of Health and Family Welfare, we decided to partner. And when the Prime Minister announced that while 2030 is the goal for eradication of tuberculosis, it's going to be brought forward to 2025. And then out of that came, what was our contribution going to be to achieve this particular goal? And that contribution, ladies and gentlemen, is that we decided that we will leverage on our 10,000 corporates, we will leverage on the 3 lakh small and medium enterprises, because the truth is, anybody who pays you, you listen to them. You can sit in a clinic and a doctor can counsel till the cows come home, but the message just remains while you're in the room. The moment the door opens, that message also dilutes itself. So we decided that we are going to make the corporates sensitize all our membership to this particular problem, empower them with knowledge, which in turn they can disseminate to their employees. And I'll share another example which had given us strength and experience in this. So we now have a workplace sensitization program in which we have developed a toolkit which includes a mobile app. Everywhere, for all the corporates who sign up, they are given this toolkit, which includes awareness posters. The human resource department is made to understand that they need to have within their organizations cheerleaders. And who are these cheerleaders? People who've had the disease, who've been able to access care and ensure that stigmatization doesn't happen. Stigmatization is not only isolated in an Indian context, it's everywhere in the world. So you have to have these cheerleaders. And touch wood, especially in COVID, this really came to fore, and this movement has given us that strength and the learning to make this happen. We didn't stop here. This toolkit is launched, and it's an ongoing process, in which we invite the state governments for a round table where we share the toolkit as well as give a platform for a very participatory, open discussion between the government as well as the private sector and corporates, so that any assistance each other may need is sorted right there. So this concept of an open state and central dialogue to iron out issues has been hugely, hugely helpful. I will share another example, and that is what we do with school children, right? In schools, we started with the state of Himachal Pradesh in 2010. We trained children because we realized that in communities, especially outreach, they are hamstrung in the form of being able to read, as well as to be able to access or even express their concerns. So, from the standard 9 to 12, we have a program which is called the General Duty Assistant Training Program, along with others. The child is free to take whichever one they want. When they finish school, they get a school leaving certificate, they get an employable certificate as a general duty assistant if they so wish to get into that, the medical field. But at the end of the day, what is the most important thing that we have done? We have equipped the child with the knowledge of healthy living. Through the course, we take them to the primary health centers, community health centers, so their communities know where to go, know where your centers are. Till this doesn't happen, change will not happen. And touch wood, during COVID crisis, this has been hugely, hugely beneficial. I have precisely 2 minutes left, and in these 2 minutes, I would like to share that the society here is working extremely closely with CII. We have already kick-started the awareness program, and going forward, we will replicate exactly what we have done for tuberculosis for thalassemia, because the platform is the same. There is no point in reinventing a wheel which has already worked. As you would all know, we've shared with the society what all we have done for awareness, and it's not going to be a one-time effort. It will be a continual effort. So with those, I thank you for giving us this opportunity to speak and share.
Thank you, Dr. Shabnam, for sharing the positive results of your various initiatives and committing CIA support to our fight with thalassemia. That support is very much needed, because you can bring much more support as well along with that. And I thank you in that, and we look forward to your continuing engagement with the thalassemia condition. WHO has also been another very important and a fundamentally important partner for thalassemia and the change for thalassemia that we seek for. And I now invite Dr. Neelam Dhingra, MD, Unit Head of Patient Safety Flagship, A Decade of Patient Safety 2020 to 2030 World Health Organization Program. And Dr. Neelam will be talking on thalassemia and sustainable development goals. Do we have Dr. She'll be joining online? Yeah. So Dr. Neelam will be joining online. Dr. Neelam, we look forward to hearing from you to take this discussion forward.
Thank you very much, Dr. Mahajan, and namaste, and I bring you greetings from the World Health Organization in Geneva. First of all, I would like to express my gratitude to the organizers for inviting me today for such an important event. It's such an honor and privilege for me to join and to hear the previous speakers. It's been really a remarkable efforts, I must say, in India and internationally on prevention and management of thalassemia to have safer care around the world. Now, I come from the program of patient safety, so I'm going to speak on thalassemia and the Sustainable Development Goals from the patient safety perspective. I'm just going to share a couple of slides to walk you through my message about safer care around the world. So when someone goes to a healthcare system or healthcare service, actually a patient is defined as somebody who accesses the healthcare system. So whether we are focusing on patient-centered care, but more importantly, as was mentioned by Dr. Singh, a person-centered care, no one should be harmed in healthcare. And the faith we go to a healthcare system is that we are going to be attended to, we are going to be listened to, and we are going to be treated and cured as well. But very unfortunately, there's a huge burden of harm which happens in healthcare. If we look at globally the burden of unsafe care, adverse events are likely to be one of the top 10 leading causes of death and disability worldwide. And 1 in 10 patients are harmed while receiving hospital care, even in high-income countries. The estimates for low and middle-income countries show that in hospitals in LMIC, about 134 million adverse events occur, which contribute to about 2.6 million deaths annually. And this does not include, this is a real gross underestimate. So there's a huge, huge burden of unsafe care. And WHO and partners around the world have looked into how do we address this burden of unsafe care. Because when we are moving towards our journey for universal health coverage and towards the achievement of sustainable development goals, we can't achieve that if there's huge amount of burden of unsafe care and people then don't trust the healthcare system. Since 2016, there has been a global patient safety movement recognizing the huge burden of patient harm which occurs around the world. And political leaders from countries, particularly UK and Germany in the beginning, came together to call for and organize an annual global ministerial summit dedicated to patient safety. And that brought together political leaders and experts from around the world. And there have been so far 4 successful summits in London, in Bonn in 2017, in Tokyo in 2018, in 2019 in Jeddah, and now the next summit is planned in Montreux, Switzerland in 2023. And these summits have really galvanized the global action on patient safety, and WHO has been a global leader working with the political leaders from around the world to take forward this movement. The momentum created from the global patient safety movement led to a landmark resolution and a watershed moment for patient safety in May 2019, when the World Health Assembly adopted a resolution on global action on patient safety that also recognized patient safety as a global health priority and established an annual World Patient Safety Day to be observed on 17 September. In addition, the World Health Assembly also asked WHO to formulate a global patient safety action plan, which is aligned with sustainable development goals. We work with member states and partners around the world, and last year, in May 2021, WHO launched Towards Eliminating Avoidable Harm in Healthcare, a roadmap for next 10 years, the Global Patient Safety Action Plan, which gives a vision that a world in which no one is harmed in healthcare and every patient receives safe and respectful care every time, everywhere. This Global Patient Safety Action Plan is based on 7 strategic pillars and had some very important guiding principles as well. But I will just share with you the titles of the 7 strategic objectives, and I'll just go through only 2 of them to bring my message for today's session. So the first of all is policies for zero patient harm. We should target and aim to achieve zero patient harm in healthcare, and we should develop policies for achieving zero patient harm. High reliability systems and organizations, safety of clinical processes, patient and family engagement, healthcare worker education, skills and safety, information, research and risk management, and synergy, partnership, and solidarity. These 7 strategic objectives provide a very strong foundation to achieve patient safety and eliminate avoidable harm in healthcare through a very comprehensive and systems approach. The most important one which I want to highlight is safety of clinical processes, which is to assure that every process which takes place around the world is safe. And importantly, coming to this meeting, I thought there were some very important points to mention that in the process of management of thalassemia patients, we have to ensure diagnostic safety. We have to, of course, ensure blood transfusion safety by prevention of transmissible diseases, and also safe transfusion practices by identifying safe patient identification, which is correct, and also the entire process of transfusion has to be safe. Medication safety, particularly for iron chelation treatment, medical device safety and surgical safety, for several other safety aspects cross-cut the thalassemia management in case of and ensuring patient safety. The 5 strategies which are identified under this particular strategic objective are also extremely cross-cutting and applied to management of thalassemia at all levels. Safety of risk-prone clinical procedures, the Global Patient Safety Challenge of WHO on medication without harm, which I'll speak about a little later, infection prevention and control and antimicrobial resistance, safety of medical devices, medicines, blood and blood products and vaccines, and patient safety in primary care and transitions of care. These are the 5 strategies under which there are very specific actions in the Global Patient Safety Action Plan, which will help us in moving towards safety of all clinical processes. The other important strategic objective I want to share with you, which was also mentioned by our previous speakers, about patient and family engagement, to engage and empower patients and families to help and support the journey of safer healthcare. And this is extremely important, again, when we are looking at management of thalassemia patients, to involve patients and families and allow their participation in healthcare, in their own care, and as well as getting their input into organizational governance, as well as at the policy level. Ensure adequate education and counseling of patients and families for prevention and safe thalassemia management. And this is also where there's a very important role of International Thalassemia Day to bring about the awareness of global community and people around the world on what thalassemia is and what needs to be done to prevent it. And if there is a patient of thalassemia in a family, how do you really go about managing and getting a safe treatment and management in the healthcare system? And what is your role to make sure this process is entirely safe and actually helps the treatment and the normal lifespan of the patient? Some of the important key strategic objectives and strategies under this strategic objective are co-development of policies and programs with patients. So patients and families are fully involved in how do we take forward policies and programs, learning from patient experience for safety improvement, patient advocates and patient safety champions, patient safety incident disclosure to victims and harm and those who have been harmed. If there is something goes wrong, then we have to disclose to patients why it happened and what is the learning from it. And extremely important is to for information and education of patients and families. So these were the 2 strategic objectives I wanted to highlight, particularly for today's webinar. Now, looking at how do we align patient safety with the Sustainable Development Goals. And this is actually also part of the Global Patient Safety Action Plan, where we identified that not only to SDG 3, which is on good health and well-being and relate the health-associated SDG, several other SDGs also where patient safety and safer healthcare contributes to. Now, most importantly, I would like to highlight on the SDG 3, which is achieve universal access and health coverage, including financial risk protection and access to quality essential health care services. And I think this is where our efforts in safe thalassemia management and prevention are going to contribute to. We cannot achieve universal health coverage and we cannot achieve Sustainable Development Goals if we do not focus on the SDG 3, and thalassemia management and patient safety contribute significantly to the SDG 3 targets. Patient safety is absolutely at the heart of universal health coverage. Looking at the financial cost of unsafe care, money is lost treating safety failures and readmissions and extended stays and surgeries, litigation costs if something goes wrong in the healthcare system, the legal fees and compensations, huge health cost of unsafe care because of huge burden of harm, which is through morbidity and mortality due to adverse events, and excess cost of unsafe care. While we are trying to expand the coverage to patients in the journey for universal health coverage, the volume of patient is lost if there's loss in faith in health system, and there's altered health seeking behavior, which is counterproductive. So patients will not come to healthcare system if they don't trust the health system. So patient safety is truly at the heart of universal health coverage. And with this, we have actually been observing the World Patient Safety Day, aligning also with messages on International Thalassemia Day. And this year, the theme for World Patient Safety Day is medication safety. And we've given some tools to the global community and organizations around the world. Most importantly, I want to mention a patient engagement tool on 5 moments to medication safety, which is when you start, when you take, and when you're adding medications or reviewing and stopping medications. There's an extremely important role which patients and families have to play to ensure medication safety. And we've also developed a campaign for this day on medication safety, which is before you take, for the patients, know, check, and ask your medication. And for the healthcare professionals, before you give it, know, check, and ask the medication. So we hope that this particular Know, Check, Ask campaign would help in bringing the healthcare professionals and patients and families together so that they are more informed in the management of their own condition. And they can also contribute at the broader level, at the organizational policy level. So in the end, I would say that all the efforts of WHO for the next 10 years and working with partners and member states are towards eliminating avoidable harm in healthcare. And we ask International Thalassemia Federation and all the partners today to join us in this journey. And with this, I would like to also congratulate you and wish you a happy International Thalassemia Day tomorrow. And be aware, share, and care. And join us in this journey for achieving patient safety globally. Thank you so much indeed for this time and this opportunity.
Thank you, Dr. Dhingra, for summarizing the initiatives by WHO. And we definitely look forward to partnering with you to bring this, safety and sustainable goals for thalassemia patients in India. We have a slight change in program, so we will next have Shri Harsh Mangala, Director, Ministry of Health and Family Welfare, Government of India. The National Health Mission in India envisages the achievement of universal access to equitable, affordable, and quality health care for every patient in our country. Thalassemia or hemoglobinopathies have been one of the key areas of focus of the National Health Mission, and their guidelines published in 2016 have gone a long way to give a direction to both the state and central initiatives as to what thalassemia care should be and can be. And we are still working on that. And we look forward to more engagement from the National Health Mission. So we now have Shri Harsh Mangala, and we look forward to hearing from you.
Good afternoon all. I hope I am audible to everyone and my video is also visible. Can someone confirm, please?
Yes, we can hear you well.
Okay. Yeah. Okay. I am right now actually out of the Delhi for attending a program of Central Council meeting of Health and Family Welfare. So I am sorry I am not able to recognize the participants physically, but through the list I would like to convey my regards to Mr. Deepak Chopra, President Thalassemia India, and also Ms. Sobha Tuliji, Secretary Thalassemics India, and the other speakers who have already spoken before me, and the eminent speakers who will speak after me. I give my regard to all of them. I am being suggested to speak about this NHM's journey on Thalassemic India. I have joined the ministry in 3 months back, and I am looking after this subject director level. What I have seen during these 3 months that NHM supports this disease in whatever manner the ministry has planned through its guidelines. So as we all know that thalassemics is one of the blood disorders which is very rare and it's very complicated disease because I have also come across a few my known who are dealing with this disease in their family. So this is very sensitive topic, and I am very grateful to all the people who are involved in this. I can say that the mission to prevent the people suffering who are suffering from this disease, and people who are taking care of them. I salute them. NHM has issued the guidelines in 2016, though NHM was launched in 2005 in the name of National Rural Health Mission. Later on, it converted to National Health Mission by involving the National Urban Health Mission also. The strategy of identifying the possible patients has always been like screening of possible pregnant women, premarital counseling also. Then when the newborn babies are screened this can be identified. Now, identification is also one part which is also lacking in our country, that we are not having the full number, estimated numbers, what is the prevalence in India. That thing I think we all need to work upon together. Now the treatment part is also very limited, as we do the drugs part. Some drugs are given, blood transfusion is given. That is also very costly, and we sanction from the states whatever proposal we get for the numbers they propose to us. In NHM we have a exercise which was previously annual exercise, which we call PIP. Now we have shifted to 2 years exercise, and I have been part of few exercises for various states demand from us the cost of the drugs and blood transfusions, and based on the norms cost, whatever cost has been prescribed by the government of India, we sanction the budget to all the state governments. And after that, state governments take care of the patients who are registered in their registry, or whatever contact they have with the patients. I'm sure the local level chapters or federations might be actively working with the state governments in this behalf. Another support area is PMJ. You must be knowing that Pradhan Mantri Jan Ayush Yojana is also launched from 2-3 years back. As this is also being mentioned by the previous speaker, that in SDG, financial risk is also mentioned. So to prevent the financial impact of the patients, this Jan Ayush Yojana has been launched, whereby the patients can go and take whatever services are listed in this scheme free of cost in the hospitals, in the empaneled hospital. Though I am told that this benefit is limited to the very small section of the patients segment of the thalassemia, because that scheme is oriented to particular population which are covered in socio-economic caste census. Some criteria has been fixed for that. Now, another initiative has been done by the ministry, that we are now preparing the ABHA IDs. So ABHA IDs is the unique number which is given to all types of patients who are going to some health facilities. First time they are going, then they can register themselves with a unique ID, and this unique ID can be used across various health facilities overall India. And this unique ID will enable, it is optional for the patient to share with the hospital facility. It's not mandatory, and because it keeps the sensitive information of his history, his medical history. So but if it can be shared with some other facilities by the patient, then probably the medical fraternity can come to know about the treatments the particular patients is being taking for the past few months or years, whatever. So I think this ABHA ID can be of great help in, particularly thalassemics patients, to create their own unique IDs. In that, I'm not saying that it will be creating some subset. I'm saying that this ABHA IDs can be used in a larger scale by the planners and by the policymakers focusing on the Thalassemics India. Now, blood banks are also supported by ministry in NHM. We provide support for blood bank, establishing blood bank, running the blood banks, and obviously because blood is the important part of this disease. And this, in a way, blood bank is also very much helpful for the patients, and we are also fortunate to support this activity of the states. Now, I would like to focus on the Thalassemic Bal Seva Yojana, which is a unique scheme which is being run by Coal India in association with ministry. They fund the costing of bone marrow transfusion for the eligible children who are till particular age. If they find the donor, then this transfusion is done. And till now, the income limit was 5 lakh rupees for a family to make them eligible for this transfusion. There was a demand from the all experts. They are great experts in the committee who runs this scheme. And Ms. Shobha Tuli is also actively participating in this exercise, this meetings. She actively participates. She presents to the committee the possible candidates for the clearance. And there was a demand that this limit from 5 lakh rupees should be raised to 8 lakh rupees so that more families can be covered in this scheme. Now, I am happy to tell you that ministry is actively considering this proposal, and hopefully this limit will be raised to 8 lakh rupees by crossing all the formalities in the ministry. And also there are some issues of essential drug list. There is some demand of adding few drugs in the essential drug list maintained by the ministry, which is followed by the state governments. So I'm sure that part will also be taken care soon. I am at director level. I can commit my full commitment for your agenda, and it will. I can only say that by this help and support to such thalassemic patients, everybody is doing a great service to the community. It's not the normal patient service. It's the very abnormal patient service, which is very rare, and the service providers or caregivers are also very special for this disease. I can commit full commitment from my side, from the ministry, whatever is possible under the domain of NHM. I'm participating in this seminar on behalf of my additional secretary and my joint secretary who are dealing with this this subject in the NHM. I convey my regards to all of you. I can convey my congratulations for this International Thalassemia Day you are celebrating. And I am here, I am available. Thank you all.
Thank you, Mr. Mangla, for sharing the NHM's vision and the journey on thalassemia thus far, and for committing your support to all ongoing initiatives in this area. Thank you so much for joining us today. Whatever we have achieved over the last many years has really been with the wholehearted support of governments, both at the center and the individual state levels. In Delhi, we've been really very fortunate to have a very strong partnership, and they've always been responsive to us and listened to us. And in the last couple of years, when we've tried to, reach our aspirational goals for thalassemia in terms of, getting access to ideal care for every patient and setting in place an effective prevention program, we've really been enthused with the support and the responsiveness of the Delhi government. Much of it, for all these discussions, Dr. Seema Kapoor has been an integral part of our discussions and, the vision for the way forward. And I invite her next. Dr. Seema Kapoor is the Nodal Officer, State Blood Cell, Government of NCT of Delhi. And she's going to talk on Delhi government's initiatives on the care and prevention of thalassemia. Dr. Seema Kapoor, we look forward to listening to you.
So it's a real pleasure to join you on this Thalassemia Day. And I would like to start with my wishes to Mr. Harsh Mangla, who just represented NHM, Mr. Deepak Chopra, Mrs. Shobha Tuli, Dr. V.K. Khanna, Dr. Amita Mahajan, the Ministry of Health and Family Welfare, Mrs. Vinita Saxena, Dr. Monica Rana, and the pharmaceutical, and also being a carrier of thalassemia myself, I definitely feel that there is importance that we need to look at thalassemia not as a rare disorder, but really as an important disorder, which probably is most very, very important. I'm just 1 minute. Mrs. Shobha, I've sent my slides to you. Is it possible for you to play them there?
Yes, ma'am, we'll open them shortly. Just give us 10 seconds.
So, in the meanwhile, I will just go ahead without presenting from my side the initiatives that Delhi government has taken up in starting and strengthening these services for thalassemia. So NHM has a separate mandate for thalassemia. Thalassemia and other hemoglobinopathies are the commonest disorders which we should all be looking for. And I think I definitely agree that the first thing that we don't have is the incidence. And for this, we definitely should be having one-time screening of all students of class 12 and college students. And amongst them, I would be happy to share that we have held 5 camps. Thalassemia Federation has held multiple camps, and awareness has been generated at multiple levels to eliminate the stigma that you have with the disease that is associated. So I think the first step which Delhi government has taken, and very, very important part of this has been Thalassemia Federation and many other NGOs who are working in the field of hemoglobinopathies, specifically sickle cell anemia. So if it is possible for you to share screen, otherwise just give me one moment. I'll try to share the screen in 1 minute. Mrs. Shobha, can you just share the screen from that side? I'm trying to play if it is for. Am I visible now?
No, no, just a second, Dr. Saab, please.
Okay. Right. So in the meanwhile, that
Just one sec, please.
yeah.
Just a sec.
Ma'am, is it possible for you to share the screen at your end?
I was trying to do so. I'm just again trying to do so. 1 minute. I'll try once again to share the screen. Can you share?
Or if that's not feasible, if you can just forward
Yeah, I
that.
would just probably just talk about the initiatives that the Delhi State Plebiscite.
That's fine. That's fine. Yeah.
So the first vision is to enhance and ensure one-time screening of all school-going children of class 12 and college-going to raise awareness. Methods to raise awareness has been peer champions from slogans, from NSS volunteers, and the willingness and sense of social responsibility. We definitely intend to involve major thalassemics, affected adults, educated and well-placed to steer the campaign, which goes very well with this year's Care, Share, and Look at Thalassemia as a very important disorder. The first and the most important way that we could do is to augment screening at all antenatal areas and make this mandatory. So we have about 320 labs across Delhi, of which some are mother labs, which definitely incorporate screening for mothers. And this could be either by HPLC or capillary electrophoresis. I definitely feel that the NHM should consider movement direct to the HPLC rather than based on indices, because we all know that individuals who have coexisting iron deficiency anemia or those who have promoter mutations may not be picked up if we go through the indices. But yes, the pharmaceutical and the other agency has to consider lowering its price so that we make HPLC or CE available to all antenatal mothers coming in the Delhi government. So for that, I think it's important to maintain and include all the private and public partners. And if you look at Delhi statistics, we have approximately 3.8 lakh births, the ratio being 60 to 40. And this is possible only when there is a private-public partnership. So screening should be done across all of these state and public and private sector. And here I would definitely like the inclusion of AOGD to disseminate this information to smaller nursing homes. We have birthing facilities across multiple agencies. We have ESI, Railway, MCD, central government, Delhi government, but we definitely have very, very small nursing homes, and specifically in the era of COVID, where they were scared to come to larger hospitals, the deliveries occurred at the smaller nursing homes. So until and unless the obstetric and gynecological division of Delhi actually disseminates this information to each and every practicing smaller hospital or nursing home gynecologist, I think it's not going to be possible. And for this, we have to register with the registration of nursing homes to make this mandatory screening in the first trimester. And this should be included in this for transmission of data. Once they have the number of deliveries taking place, they almost always have to enter into a MOU to share how many number of women these smaller nursing homes cater to. Having said that, we still do not have screening in many big public sector hospitals. So I think strengthening all these hospitals with equipment, which has been lacking for the last 4 years. It has been an ongoing process of procurement, and for certain reasons, it could not be procured last year. So we envisage that a spoke and hub model, so that each district of Delhi at least has one center which can directly do HPLC or capillary electrophoresis, and by this method can also include in the spoke all the birthing areas. So these birthing areas could also be smaller nursing homes who can send their patients on a designated day with an MOU that they would not be charging the patients, so that you will have a good private-public partnership mode. Along with that, this will also help you develop a registry. I think very important is actually maintaining a line listing of the patients who are tested, and this should be compiled and sent. So, and I think Mrs. Shobha's approach, she sent me a very good registry from Thalassemia India Foundation, Thalassemia International, and we also have an ICMR registry, which is a little more elaborate. So we are working and we have worked towards making a small registry. What is the outcome of the registry will tell you the load added each year, so that you can actually start giving safe leukodepleted blood. Now, I think our previous speaker from WHO importantly strengthened the value of safe. So it should be safe, it should be available, it should be leukodepleted. All window testing areas should be done. And I think for this, we need to have good areas, at least 2 public facilities and probably 1 or 2 other private sector facilities who are looking at advanced testing for safe blood. And this should be implemented probably this year if everything goes well and we don't have a COVID wave, which delays any of our objectives. Definitely, as Mr. Harsh Mangla also said, there's a very important reason that we should include our voluntary blood donation camps. And even when there is COVID, we should encourage that the patient should be admitted to the hospitals in a safer zone wherever they are undergoing their transfusions, so that it is not disrupted. We have seen in the COVID wave 2 and in the 3rd wave that there was definite disruption of blood services. It is hats off to Thalassemia Foundation, to many public sector and private sector hospitals who continue to provide these services with great insistence of the patient support group, specifically Mrs. Shobha Tully's group, so that we could at least deal to some of the patients that were still there in the area of Delhi. So I think the second most important thing is, once the diagnosis is made in the antenatal period, what next? How can we enhance prenatal diagnosis? So if we actually look at the carrier rate across Delhi, it varies from 9 to 17%, taking an approximate percentage of 4, approximately 600 antenatal women will be requiring molecular confirmation for thalassemia and other hemoglobinopathies. So in this group, we need to include and recognize fetal medicine specialists who would be able to actually deliver these services. We should be also in state blood cell recognizing all centers who can genotype and exclude maternal cell contamination. I think NHM has been very important in capping all trades of prices across COVID-19 and in many other sectors of health. I think similarly, we should have a cap on the genotype results, which include maternal cell contamination, so that we can provide prenatal diagnosis. So there are 3 pillars. Number 1, starting a registry, which will be, it's important for all public sector and private sector hospitals to enroll. Otherwise, 5 years down the lane, and adding every year the number of newborns or the number of babies in the 1st or 2nd year of life, which have been diagnosed by any sector, to contribute to the total burden, so that we know how much blood we'll be requiring, what will be the drugs that we would be requiring, and how many of them would require experienced facilities. Another very important thing which is there is availability of services. I think I commit to more available leukodepleted bags, and it has been the previous NHM, the dynamic leadership of Mrs. Vinita Saxena, who has made this a very achievable target to include leukodepleted bags. The drugs are available in the EDL, but they are not uniformly available across all public sector hospitals. So I promise to do my best to make these drugs available to EDL, not only in public sector, but also probably in the private sector once they have enrolled once in a public sector hospital, because they are out of the ambit even of the middle class. Therefore, including these drugs for those patients is very important. So not only in terms of capping the prices, in terms of availability, in terms of enhancing antenatal and prenatal services, in terms of education, I think it's very, very important to establish more daycare centers with the dynamic leadership of NHM, with the efforts of all of you. Probably we would also look at 2 advanced testing facilities so that there is safe blood to all. And I think much more importantly, we would definitely think that we should recognize carrier status not as a stigma, voluntarily come out, involve the social media, involve students, involve youth, have a campaign, increase awareness amongst physicians, amongst patients, and their family members, so that the cascade screening process picks up a large number and reduces the pool of ultimate thalassemia to the Delhi state. With that, I extend my hearty thanks for inviting me for this occasion. What I can do is to promise to do my best in the given situation on all the 3 pillars that I've talked for and make it a reality rather than this being a speech. That is, and I thank Thalassemia Foundation. I thank Mrs. Vidita Saxena. I thank Dr. Monica Rana and the Ministry of Health and Family Welfare, Delhi government and central government for making me capable of at least thinking of doing something for the state blood cell in Delhi state. Thank you so much.
Thank you, Dr. Seema, for joining us today. But even more importantly, for all your dynamism, for your enthusiasm and the energy that you've given to this project. We've been in touch with Dr. Seema over the last few months, and our one and only request to her was on 8th of May, ma'am, please announce the state blood cells commitment to each and every area that we aspire for. And thank you so much. You respected that, and you have today committed support for each element of thalassemia care and prevention that we requested you of. And we look forward and we are fully confident that with you at the helm of State Blood Cell, we will see soon a very coherent and inclusive program both for care and prevention of thalassemia in Delhi. So thank you so much for all the support that you've given us. I now hand over to Mrs. Tuli to invite and welcome our chief guest for the day, Shri Rajendra Pal Gautamji, Minister of Social Welfare, Government of NCT of Delhi.
आप सभी को थैलेसीमिक्स इंडिया की तरफ से हार्दिक अभिनंदन और वेलकम। आज हमारे बीच में दिल्ली सरकार से श्री राजेंद्र पाल गौतम जी, ऑनरेबल मिनिस्टर ऑफ सोशल वेलफेयर हमारे बीच में हैं, जिन्होंने अपना बिजी शेड्यूल में से कुछ समय हमारे लिए निकाला है। मुझे याद है 2-3 दिन पहले भी वो एक हमारे रोटरी फंक्शन में हमारे साथ थे, तो मैं उनका हार्दिक अभिनंदन करती हूँ और धन्यवाद करती हूँ कि उन्होंने ना सिर्फ थैलेसेमिक पेरेंट्स को, डॉक्टर्स को, पर जो हमारे पेशेंट्स हैं, जो मेन सफरर्स हैं, उनको प्रोत्साहित करने के लिए आज हमारे बीच में हैं। जैसा कि मैंने पहले कहा था कि दिल्ली एक ऐसी स्टेट है जिसके अंदर से डिसेबिलिटी के जो बेनिफिट्स हैं, वो मैं कहूँगी कि अगर मैं भारतवर्ष के अन्य स्टेट्स के साथ कंपेयर करूँ तो दिल्ली सबसे ऊपर आती है। उसके कुछ कारण हैं। सबसे पहले तो ये है कि दिल्ली के जितने भी पेशेंट्स हैं, उनके जो कार्ड्स बनते हैं और उसके लिए उनको जो सुविधाएं दिल्ली सरकार ने दी हैं, जो 11 हॉस्पिटल्स उन्होंने डिक्लेयर किए हैं और जिस तरह से हमें वहाँ पे मेडिकल बोर्ड से सहूलियत मिलती है, उसकी वजह से हमारे जो कार्ड्स हैं मिलने में उनको आसानी होती है। इसके अलावा जो एक हमने रिक्वेस्ट की थी भारत सरकार से, मिनिस्ट्री ऑफ सोशल वेलफेयर एंड एम्पावरमेंट से, कि इसकी जो लिमिट है वो 1 साल से 3 साल तक कर दी जाए, जो कि उन्होंने मान ली। तो आज हमारे जो कार्ड्स हैं जो डिसेबिलिटी के, वो सब 3 वर्ष के लिए बनते हैं। मंत्री जी, फिर भी मेरी कुछ आपसे रिक्वेस्ट हैं। एक तो सबसे पहले ये है कि अब दिल्ली के अंदर दिल्ली सरकार ने एक कानून दे दिया, डायरेक्टिव दे दी कि अब ये कार्ड जो है वो दिल्ली जुरिस्डिक्शन के अंदर बनेंगे। अगर कोई साउथ दिल्ली में रहता है तो उसको साउथ दिल्ली के हॉस्पिटल में जाकर ही कार्ड बनवाना पड़ेगा। उससे कुछ दिक्कतें आ रही हैं, वो दिक्कतें बड़ी प्रैक्टिकल हैं, और वो ये हैं कि वहाँ जो डॉक्टर्स बैठे हैं, जो मेडिकल बोर्ड्स बैठे हैं, उनके पास या तो पूरी सुविधाएं नहीं हैं या पूरी जानकारी नहीं है। जैसे कि जब भारत सरकार ने 3 साल दे दिए, उसके बावजूद भी जो कार्ड्स बन रहे हैं अभी भी कुछ 6 महीने के लिए बन रहे हैं, कुछ 1 साल के लिए बन रहे हैं, कुछ 2 साल के लिए बन रहे हैं। तो हम आज अंतर्राष्ट्रीय थैलेसीमिया दिवस पर, जैसे कि आपने देखा कि हमारा जो स्लोगन है बी अवेयर शेयर एंड केयर, ये स्लोगन टिफ ने हमको थैलेसीमिया इंटरनेशनल फेडरेशन ने रिलीज किया है, जिसको पूरे ग्लोब में ये दिवस जो है 110 कंट्री से ऊपर आज के 8 मई को मनाया जाता है, जो आज हम कुछ कारणवश 7 मई को मना रहे हैं। तो आज इस अंतर्राष्ट्रीय थैलेसीमिया दिवस के ऊपर मैं चाहती हूं कि जितने भी दिल्ली के बच्चे हैं थैलेसेमिक, 1800 के तरकीबन, क्योंकि अभी तक हमारे पास रजिस्ट्री नहीं है, आप निर्देश दीजिएगा सभी जो 11 हॉस्पिटल्स हैं कि 2022 के अंत तक, और ऐसे निर्देश और सरकारों ने दिए हैं, सभी के डिसेबिलिटी सर्टिफिकेट्स मिलने चाहिए। इसके अलावा जो एक प्रैक्टिकल प्रॉब्लम है, वो रिटर्न में सर्टिफिकेट दे देते हैं पर उनको कंप्यूटर से नहीं निकाल पाते हैं, और अगर वो कंप्यूटराइज नहीं दिए जाते हैं तो उसका कुछ फायदा नहीं होता है। इन सर्टिफिकेट्स के बनने से जो सबसे ज्यादा बेनिफिट है वो मेरे बच्चों को है। इन बच्चों को दिल्ली सरकार ने 2500 की मंथली पेंशन देते हैं। तो मैं चाहती हूँ कि जो एलिजिबल पेशेंट्स हैं उनके जब डिसेबिलिटी कार्ड्स बन जाते हैं तो उनके लिए 2500 रुपये बहुत मायना रखती है। तो अगर ये डिसेबिलिटी कार्ड समय पर बन जाएंगे तो उनको एक और प्रोत्साहन मिलेगा, इसके लिए था। दूसरा था सर कि कुछ टेस्ट हैं जब ये कार्ड्स बनते हैं, जैसे डेक्सा स्कैन टेस्ट एक इंक्लूड कर दिया है। हमारे यहाँ पे बहुत से सभी एक्सपर्ट्स बैठे हुए हैं, उन्हीं की तरफ से मुझे ये इंफॉर्मेशन मिली है। तो मैं चाहूँगी कि आप एक बारी इन टेस्ट को जो लिखे गए हैं एक बारी रिव्यू करवा लीजिएगा कि छोटे बच्चों के ऊपर 5 साल या 6 साल के अंदर डेक्सा स्कैन के टेस्ट नहीं होने चाहिए। सो ये कुछ चीज़ें हैं जो मैं आज आपके समक्ष लाना चाहती थी। उस दिन भी जब मैं मीटिंग के ऊपर आई, तो आज आप हमारे बीच में हैं, तो प्लीज़ आने वाले दिनों में इनकी जो प्रॉब्लम्स हैं उनको देख लीजिएगा। इसी के साथ मैं फिर से आपका स्पेशली धन्यवाद करना चाहूँगी कि आज आप हमारे बीच में आए हैं। So I hand it over to Gagan, my colleague.
Thank you, Mrs. Tuli, and I'm sorry I'm going to be speaking through my mask, so I hope it's okay. And so thank you very much, and thank you. A great welcome to our chief guest, Honorable Minister, Social Welfare, Government of NCT of Delhi, Shri Rajendra Ji Gautam. We are really honored to have you here with us, sir. So may I please ask Mr. Deepak Chopra, President Thalassemia India, to escort our chief guest for the lamp lighting, along with Mrs. Shobha Tuli, Dr. Sarinda Pangar, and Dr. V.K. Khanna, please. And actually, the Thalassemia India executive, Dr. Bose, Mr. Sehgal, Mr. Malik, and Rita Jain. Please, I would request the Thalassemia India executive to be here.
दान चढ़ायो अच्छा गजमुख को, लाल विराजे कटोरी हर को, हाथ लिए गुणदंडू साई सुरवर को, महिमा कहे न जाए भागत हूँ पद को। जय देव जय गणराज विद्या संदाता, गुहानो दर्शन श्री राम लखनता।
Dr. Anita Mahathir, your बात
से कोई शरणागत आवे, धन संपत्ति सब ही भरपूर पावे। ऐसे तुम महाराज को अति भावे, मूसा भी नंदन निज जिन गुण गावे। जय देव जय देव, जय जय जी नारायण व्यास राधा, अन्य तुम्हारो दर्शन देना मन रमता। जय देव जय देव।
I now request Mr. Chopra to please escort our chief guest to the main stage. Mrs. Shobha Tuli, Dr. V.K. Khanna and Dr. Saranga Penwar, please join us on stage. Dr. Saranga? Yeah. And Dr. V.K. Khanna, please. So thank you very much, and that's a very auspicious, pious beginning to our Thalassemia Day celebration, sir. May I request our chief guest to please come and address the audience before we move into the felicitations. Yeah. And first we would like to felicitate our chief guest with our flowers. So Sonam and Swati, on behalf of Thalassemics India and TPAG, please. May I request Shri Gautam to please come and say a few words.
मंच पे आसीन सभी अतिथिगण, डिसेबिलिटी कमिश्नर रंजन मुखर्जी और सभी उपस्थित सज्जनों, आज सबसे पहले तो मैं धन्यवाद करूंगा मिसेस तुली को कि उन्होंने इंटरनेशनल थैलेसेमिया दिवस पर मुझे बुलाया, और ये जो अवेकनिंग का काम बेसिकली आप वर्षों से कर रही हैं, बहुत ही काबिल तारीफ है। दो बातें आपने अभी यहाँ मुझसे रिक्वेस्ट की है, तो एक तो मैं बता दूं कि ये 11 हॉस्पिटल में आप कहीं भी बनवा सकते हैं कार्ड, यूडीआईडी कार्ड। वो ऑलरेडी हम नोटिफिकेशन निकल चुका है, ऑलरेडी हम डिसीजन ले चुके हैं। तो ऐसा नहीं है कि डिस्ट्रिक्ट में ही आप कराएंगे, पूरे दिल्ली के जो 11 हॉस्पिटल हैं, जिसमें आरएमएल भी है, एम्स भी है, जेटीबी भी है और दूसरे हॉस्पिटल्स हैं, तो कहीं पे भी जाके यूडीआईडी कार्ड किसी भी डिस्ट्रिक्ट में बनवाया जा सकता है। कोई बैरियर नहीं है कि आप पर्टिकुलर एक अपने ही डिस्ट्रिक्ट में बनवाएंगे। दूसरा, जो एक टेस्ट की बात आपने की कि वो 5-6 साल तक के बच्चों का नहीं होना चाहिए, उस पर बहुत जल्दी हम अपने जो हेल्थ मिनिस्ट्री है, मिनिस्टर साहब से बात करके, हेल्थ डिपार्टमेंट से बात करके इसको इसमें भी डायरेक्शन दे देंगे कि ये ना किया जाए। और दूसरा, मैं आपसे भी निवेदन करूंगा कि जो भी इस फील्ड के एक्सपर्ट्स हैं, जो जानते हैं कि क्या क्या करना जरूरी है, वो लोग एक दिन मेरे साथ बैठ लें, तो जो आपके सजेशंस हैं उनको लेके उसको फिर हमने केवल बात नहीं करनी, उसको रिजोल्व भी करना है। और हमारी जो सरकार है वो एक संवेदनशील सरकार है। हम लोग केवल संवेदना व्यक्त नहीं करते, बल्कि हम लोग कोशिश करते हैं समस्या का अगर पता लग जाए तो समस्या का समाधान होना चाहिए, उसी के लिए सरकार है। वरना फिर सरकार का होने का कोई फायदा नहीं हो, तो अफसर भी चला सकते हैं। और दूसरा, आप लगातार इस फील्ड में काम कर रहे हैं, तो जो एक तो सबसे बड़ी प्रॉब्लम ये कि इस बीमारी का कोई ऐसा ठोस इलाज नहीं है कि परमानेंट कोई इलाज हो, और बोन मैरो भी इतना इजी नहीं है, उसका मैच करके देखना, फिर देखना किसका हो सकता है, नहीं हो सकता है, काम कठिन है। लेकिन हम जो एज ए सरकार कर सकते हैं, पहले यूडीआईडी कार्ड बनने में दिक्कतें थी, और लोगों को पेंशन बनने में दिक्कतें थी, लोगों का डिसेबिलिटी सर्टिफिकेट बनने में दिक्कत थी। हमने उस दिक्कत को रिजोल्व किया और रेगुलर कंपलसरी हमने कैंप्स हॉस्पिटल के अंदर लगाने शुरू किया, अलग अलग डिस्ट्रिक्ट के अंदर, अलग अलग हॉस्पिटल्स के अंदर। और आप तो खुद उसमें शामिल रही हैं, जहां सेम डे उनको डॉक्टर देखते हैं और उनको असेसमेंट करने के बाद सेम डे उनको यूडीआईडी कार्ड और साथ में डिसेबिलिटी सर्टिफिकेट भी इशू कर रहे हैं। और हमने अपने सोशल वेलफेयर डिपार्टमेंट को और साथ ही साथ हेल्थ एंड फैमिली वेलफेयर डिपार्टमेंट को इंस्ट्रक्शंस दिए कि डिसेबिलिटी से संबंधित कोई भी इशू है उसको तुरंत रिजोल्व करना है, और फिर भी कहीं कोई दिक्कत आती है तो आप हमें बताइए, जो सरकारी लेवल पे चाहिए उसको हम लोग तुरंत उसको रिजोल्व करेंगे। लेकिन मुझे लगता है अवेयरनेस पे हमें और ज़्यादा काम करने की ज़रूरत है। हम लोग ठीक है ये सब जरूरी है, आज यहाँ कर रहे हैं प्रोग्राम, लेकिन इसके साथ साथ मुझे लगता है कि हमें डिस्ट्रिक्ट्स के अंदर जाके कोलैबोरेशन में एक तरफ गवर्नमेंट और फिर जो आपका जो है थैलेसेमिक्स इंडिया या और जो दूसरे संगठन इस पे काम कर रहे हैं, अगर वो सब हमारे साथ मिलके एज ए पार्टनर काम करेंगे तो शायद हम और ज़्यादा बेहतर तरीके से परफॉर्म कर पाएंगे। गवर्नमेंट तो काम करना चाहती है, गवर्नमेंट की इच्छा शक्ति काम करने की है, हमारा विभाग हमेशा इस पे तत्पर है और आपका भी इसमें सहयोग मिलेगा। हम और आप मिलके और ज़्यादा बेहतर तरीके से आगे काम करेंगे और कोशिश करेंगे कि कहीं भी अगर कोई इश्यूज आते हैं तो उन इश्यूज को विद इन टाइम बाउंड मैनर उसको रिजोल्व करेंगे। और मैं आपको शुभकामनाएं देता हूं कि आप कंटिन्यूसली इस दिशा में लोगों को अवेयर करने का काम कर रहे हैं और हम और आप मिलकर और ज़्यादा बेहतर तरीके से निचले स्तर तक जाके लोगों के बीच जाके अवेयरनेस के काम को भी बढ़ाएंगे और साथ में जो इश्यूज आते हैं उसको भी टाइमली रिजोल्व करेंगे। और आपने मुझे बुलाया सम्मान के लिए, इसके मैं आपका आभारी हूँ। बहुत बहुत धन्यवाद, शुक्रिया। जय हिंद, जय भारत।
बहुत बहुत धन्यवाद श्री गौतम, आपके वर्ड्स बहुत इंस्पिरेशनल है एंड थैंक यू।
सर, आपके आने से पहले हमने आज का जो कार्यक्रम है इसको 3 भागों में वितरण किया था। जो पहला था उससे विदेश से WHO के, टिफ के और दूसरे डॉक्टर, CII कन्फेडरेशन ऑफ इंडियन यूनिवर्सिटी के भी लोग हमारे साथ जुड़े हुए थे। और दूसरा जो हमने रखा है, जो कि हमने अभी इस फेलिसिटेशन सेरेमनी के बाद करेंगे, वो एक पैनल डिस्कशन है। तो मुझे कहते हुए बड़ा गर्व हो रहा है, जो हमने कभी सोचा भी नहीं था 1970s 80s में, कि हमारे बच्चे जो हैं अब हमारे सामने आएंगे, आगे आएंगे बढ़ के। तो थैलेसेमिक्स इंडिया ने TPAG ग्रुप फॉर्म किया था और सिसोदिया जी ने उसकी इनॉग्रेशन की थी 5 साल पहले। तो जो पैनल डिस्कशन को आज चेयर करेगी, मॉडरेट करेगी, वो निष्ठा मदान, जो कि एक थैलेसेमिक है खुद। तो हम ये चाहते हैं। और जो तीसरा है वो है ऑफ कोर्स कि दिल्ली की, जो भी दिल्ली के अंदर हमें सफलताएं मिली हैं, वो जो यहाँ पे बैठे हुए डॉक्टर्स हैं, एक्सपर्ट्स हैं, ये सब उन्हीं की मेहनत और लगन, और ब्लड ट्रांसफ्यूजन सर्विसेज के लिए भी, ब्लड बैंक से भी, दिल्ली सरकार से भी जो लोग आए हुए हैं, उन्हीं की वजह से ये बदौलत है कि हमारे बच्चे आगे तरक्की कर रहे हैं। तो हमें दिल्ली सरकार से स्पेशली सपोर्ट चाहिए कि एटलीस्ट दिल्ली के अंदर जो है 1800 बच्चे हैं, उनको निःशुल्क दवाएं मिलनी चाहिए। तो ये डिसेबिलिटी एक्ट, RPWD एक्ट के अंदर भी आता है। तो मेरी एक और निवेदन है आपसे कि अगर आप इसको दिल्ली सरकार की जो स्वस्थ सेवाएं के लिए, अगर आप उनको भी बीच में हमें इस जॉइंट प्रोजेक्ट के अंदर कहेंगे, प्रोत्साहित करेंगे, तो इन सब बच्चों को फ्री दवाएं मिल सकेंगे। और इन बच्चों के अंदर बहुत प्रतिभा है सर। मैं चाहती हूं कि कोई भी माँ अपने जीवन में इन बच्चों को दवाइयों के लिए वजह से ना खोए, और ये बच्चे सोसाइटी को वापस, जैसे कि और नॉर्मल बच्चे देते हैं, उसको कंट्रीब्यूट करें ताकि हमारा देश आगे बढ़े। इसी शब्दों के साथ मैं एक बारी बीच में आई हूँ और अब गगन फेलिसिटेशन सेरेमनी जो है वो शुरू करवाने जा रही है। थैंक यू वेरी मच।
आप बच्चों की लिस्ट दीजिए और किस तरह का सपोर्ट चाहिए वो भी लिखित में दीजिए मुझे, और मैं कोशिश करूंगा मुख्यमंत्री जी से बात करके इसको तुरंत ही रिजोल्व कराऊं, उसमें ज्यादा समय ना लगे।
थैंक यू वेरी मच सर। अब इसके साथ ही हम आज का फेलिसिटेशन सेरेमनी शुरू करते हैं। इस सेरेमनी को शुरू करने से पहले हम सिर्फ 2 शब्द बोलेंगे कि आज जिनको फेलिसिटेट किया जा रहा है, ये केवल वो हैं जो दिल्ली में प्रेजेंट है, दिल्ली और NCR में। लेकिन हमारे साथ लॉकडाउन और उससे पहले भी सारे पैन इंडिया से जो डॉक्टर जुड़े हैं, जो केयर गिवर्स जुड़े हैं, जो ब्लड बैंक्स जुड़े हैं, जो हमारे स्टाफ है हॉस्पिटल्स के अंदर, हमें मालूम है एज पेरेंट्स वो हमारे लिए कितनी अहमियत रखते हैं। उन सबका हम लोग बहुत 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 आभारी हैं, क्योंकि उनके बिना हम लोग आगे नहीं बढ़ सकते। हमारे ब्लड बैंक्स, हमारे डॉक्टर्स, हमारी नर्सेस, इनके बिना हम आगे नहीं बढ़ सकते हैं। तो आज केवल हम लोग दिल्ली के डॉक्टर्स को फेलिसिटेट करेंगे और सबसे पहले मैं बुलाना चाहूँगी डॉक्टर मनोरंजन महापात्रा। श्री गौतम प्लीज आप आएंगे सर। Dr. Manoranjan Mahapatra, he's from AIIMS. He is professor and head Department of Hematology at AIIMS. He is also part of the Thalassemia Bal Seva Yojana, BMT project initiated by Ministry of Health and Family Welfare, Coal India Limited. Sir, we would like you to say a few words.
Thank you very much.
Next, I'd like to invite Dr. Jagdish Chandra. Dr. Saab is here. Dr. Jagdish Chandra from PGIMSR and ESIC, Professor of Pediatrics, PGIMSR and ESIC Model Hospital. He is a mentor and an inspiration of thousands of medical students, ladies and gentlemen. He is also the former director of Lady Harding Medical College. Dr. Saab, we'd like to see.
Well, thank you, Madam Tuli and the team here for inviting and arranging this felicitation. I think you are doing it every year, and because of COVID, we are meeting after 2 years. It's really a pleasure to see all grown-up thalassemics. As somebody said that few years back, we were not able to even dream of this thing, and we will enjoy the panel discussion that will happen. Things have really changed, and that is all efforts of NGOs. We, of course, have contributed in a way, whatever we could, but it's definitely a major effort from the NGOs. They are working in the field of thalassemia, and it's really nice to see all grown-up children. They are contributing to the society, and I think things regarding thalassemia will further change and maybe in just a couple of years' time. So with all that, again, best of luck, and thank you very much.
Next is right here, Ms. Saranga Panwar, Blood Cell, NHM, Ministry of Health and Family Welfare, Government of India. She's the senior consultant and part of hemoglobinopathies activities taken up by the ministry. Please, तालियां तो जोर से बजा दीजिए.
I thank everybody here who organized this session and also the guest for your time, sir, because it's a very sensitive topic and about Ministry of Health initiatives. Our director, Sir Harsh Mangla, sir, has already told our initiatives. I would just like to say thanks for inviting me. And also, like a lot of things, we are living in a modern world and a lot of technology, because of them, these diseases, we are able to save these patients. And we are sorry for those who have already lost their child in absence of the correct diagnosis. But I want to say one thing, because in the blood, it's been 3 months only since I'm working in the blood cell here in Ministry of Health NHM. So there also we just get request, that kind of request which is not expected from Delhi. Because we got a complaint from a patient who shifted recently, who was an IIT student, shifted recently from Bareilly. So he was getting blood transfusion there in Bareilly at regular interval. But that facility, despite a lot of efforts, he is not able to get in Delhi. So I was surprised to know that none of the hospital is taking him. So they were not aware why they are not getting registered and not getting blood transfusion. And he's a very bright child because it got admission in IIT also. So then I was asked to solve this issue. So I spoke to some people in Delhi, Dr. Seema Kapoor madam also, and then AIIMS, Dr. Tulika Sheth ma'am also. So she told me that we don't just give transfusions, हम उसको पूरी तरह से register करके पूरा उसका overall treatment करेंगे. But ये चीज patient को communicate नहीं हुई है. उन्होंने कहा patient register नहीं होना चाहते, जबकि patient को पता ही नहीं है कि हमें क्या करना है. उनको तो वो patient है, उनको ट्रांसफ्यूजन चाहिए, ट्रीटमेंट चाहिए, तो थोड़ा सा ये जो सर ने बताया कि अवेयरनेस पे बहुत काम करने की ज़रूरत है, क्योंकि एक्टिविटीज़ काफ़ी हो रही हैं, लेकिन उसके बारे में सभी को पता हो ये बहुत ज़रूरी है। जो सर ने दिल्ली के लिए बताया वो सारे देश के लिए, पूरी कंट्री के लिए इम्पॉर्टेंट है कि हर डिस्ट्रिक्ट लेवल पे एक्टिविटीज़ हों, स्टेट्स भी थोड़ा इनिशिएटिव लें। हम लोगों ने 3-4 साल पहले गाइडलाइंस इशू की थी, जारी की थी, लेकिन स्टेट्स में अगर किसी को एक बार बुला के समझाते हैं तो नेक्स्ट टाइम तक वो पर्सन, नोडल ऑफिसर ही चेंज हो जाते हैं, तो हर साल 2 साल हम पहले उन्हें बताते ही रहते हैं कि क्या करना है, कैसे करना है, तो एक थोड़ी कंटिन्यूटी रहे। अगर किसी की ट्रेनिंग हुई है इसी इशू पर नहीं, हर इशू पर अगर कोई ट्रेंड पर्सन है तो थोड़ा उसको रिटेन करने की कोशिश की जाए। मतलब मैं एक्चुअली ज़्यादा समय ले रही हूँ, बोलने के लिए बहुत कुछ है। थैंक यू वेरी मच।
थैंक यू मैम, आपने बहुत प्रॉपर मुद्दे उठाए और बहुत इंपॉर्टेंट बातें कही। एंड आई थिंक अवेयरनेस के ऊपर सोशल मीडिया का इस्तेमाल किया जाए और इसको सबको बताया जाए उसके थ्रू, और सब लोग उसके ऊपर अटेंड करते हैं। इसके बाद मैं कहना चाहूँगी मिस विनीता श्रीवास्तव के लिए, जो कि अभी आज वो नहीं ज्वाइन कर पा रही हैं, लेकिन वो हमारे लिटरली हमारे सपोर्ट कैंप का, जैसे मैं बोलूँगी, बहुत इंटेग्रल एक हिस्सा है। सो उनके लिए हम जोरदार तालियां बजा सकते हैं। उन्होंने बहुत काम किया है थैलेसीमिया अवेयरनेस के ऊपर। अब वो मिनिस्ट्री ऑफ ट्राइबल अफेयर्स में है, फिर भी इतना काम कर रही है वहाँ पे भी सिकल सेल एंड थैलेसीमिया के लिए। इसके बाद मैं बुलाना चाहूंगी डॉक्टर नुपुर तारक फ्रॉम कलावती सरन हॉस्पिटल, SMO डिपार्टमेंट ऑफ पीडियाट्रिक्स, कलावती सरन। She is looking after 250 thalassemics and 75 NTD patients under the age of 18 years. Chelation medicines are provided free of cost in this unit. Thank you, Dr. Tarak. Would you like to say something?
I just want to say thank you to the entire team, and I also want to just wish for the good luck of these thalassemic patients. That's all from the core of my heart.
Thank you so much.
Thank you.
I now invite from LHMC, I invite Dr. Ritika Sood and Dr. Shubha Lakshmi Margekar. Dr. Sood is the professor, Department of Medicine, Lady Hardinge Medical College. They are looking after 120 thalassemics. Adult ward was started in 2007. Chelation medicines, filters, and packed cell blood are provided for the patients free of cost. And I would like to share that Lady Hardinge Medical College is the only one that has a fully adult thalassemia ward in Delhi. So I think we need more of those now, since fortunately our children are growing up. We need more adult wards. So all the doctors who are sitting here from other hospitals, that is our voice to carry home. Yes.
Thank you so much. I would like to thank everybody here, and I think it would be the greatest honor, to really see our thalassemic children here. And I think Dr. Jagdish has been, central in getting this unit started. And of course, now since 2007, we have been running the adult thalassemia care center, and our numbers have been increasing almost exponentially for adult thalassemics to be. We are a little over 120 right now. And to have that many children to manage is a big number. So we hope that we are able to, continue to work better with every coming year. Thank you so much.
Thank you so much, Dr. Sood.
Thank you. And I also want to thank the team for giving us this honor. Ma'am, thank you so much for thinking that we are doing this work. And yes, as Madam told, we have more than 120 children with us. Not children, actually they are grown-ups now. So they are grown-ups now, and they are also doing very well. Few of the children are here also. It is very nice to see them working so nicely. So thank you so much, sir. And sir also thanks you for giving that support of medicines and investigation, whatever you have told. That will be very great help for these children. Thank you so much.
Thank you, ma'am. Thank you so much, ma'am. Now up, may I invite Dr. Sunil Gomber. Dr. Sunil Gomber is here. Oh, he hasn't. Okay, because of the rescheduling, I think little bit it's happened, but we'll move on to the next. Then Dr. Alka Mathur, she's here. Yes, from Hindu Rao Hospital. She is retired head of the department. 75 thalassemics are given treatment in the thalassemia unit, which was started by Dr. Alka Mathur in 2004 on 8th of May itself. So it's a big thing. Thank you, Dr. Alka. May I now invite Dr. Kirti Nanal from NDMC, Head of Thalassemia Unit in NDMC Charakpalika. She is looking after 170 thalassemics. Patients are given chelation medicines and bedside filters free of cost. Yes, that's true. They're also taking care of adult patients.
And some of them to non-thalassemics as well. That is a very, very encouraging thing. Yeah.
Thank you so much. May I now invite Dr. Ritu Chawla from DDU, head of the Thalassemia unit. 250 thalassemics are treated in this thalassemia unit, which was started 30 years back. They are given chelation medicines, filters, and packed cells, leukodepleted pre-storage blood, free of cost.
So I would like to say that our center started almost in 1990. So it's been more than 30 years, and if some of them unfortunately had not passed away, the registration number would have been around 300. And we are focusing a lot on treatment and management, but it is very painful to see so many new registrations. So I think we should focus a lot on screening and should not have any more thalassemics, at least in the next 1 or 2 years. It's not difficult. It is just screening in the school age group or college, and getting so many more till date after centers are running for 30 years is a little, disheartening. So screening, advertising from your end would really help. Thank you for the honor.
Thank you, Dr. Chawla. May I now, I'll continue with the thing while Dr. Saab is speaking. May I now invite Dr. Alok Hemel from RML Hospital, Professor, Department of Pediatrics. 50 thalassemics are treated in the thalassemia unit. Chelation medicines, filters, and packed cells, leukodepleted pre-storage blood is provided absolutely free of cost. Thank you, Dr. Saab. May I now invite Dr. S. Sudha from LNJP Hospital. Is Dr. Sudha here? Yes. Consultant, Department of Pediatrics. 120 thalassemics are given treatment in the thalassemia unit. Chelation medicines, filters, packed cells are provided to the patients free of cost.
It's not me alone, it's a whole team. I have wonderful sisters with me who actually help and know each and every patient. And the lockdown at LNHAP really affected us so badly, but we survived. Thank you so much. Thank you.
May I now invite Dr. Vibhuti Bhatnagar from the Lions Blood Bank. She is the medical director of the Lions Blood Bank and extremely helpful in arranging blood for thalassemics.
Thank you, Honorable Minister Sir, President Chopra ji, Tuli ma'am, Khanna ji,
and Dr. Bose. I'm here today for the first time, but I'm touched and I feel happy at the same time because when me and my team, with the management's support, we work for each of our thalassemic patients, this is the time that we realize how there is a bigger support behind us. So thank you, everyone, and we are always there whenever we are able to provide, being a standalone blood bank, still we are able to provide leukodepleted, net tested, antibody screened units for our friends, now more than patients, we would like to say friends, and we are happy to see them smiling today. They are married, they are giving back to society, and it's a long way to go, but with your support, we will carry on. Thank you so much.
That's with your support, Doctor. So, may I now invite Air Commodore Ranjan Mukherjee, the Disability Commissioner, Government of NCT of Delhi. Oh yes, of course. Thank you, sir. May I now invite on stage a lady I truly admire for her selfless work, amazing service. She has been single-handedly championing the cause of thalassemia awareness in Delhi and NCR. Dr. Tajinder Singh of Rotary Club of Delhi, Safdarjung, a women's club of social activists, entrepreneurs, lawyers, raising awareness about thalassemia for the past 10 years. She has been absolutely amazing in going out, reaching out to the right people, schools, colleges, corporates, speaking about thalassemia, emphasizing on the importance of thalassemia screening. Let's give it a big hand. We need more people like her.
Thank you so much. It is, in fact, a great honor to be recognized. Everybody does try to do things selflessly, but when you do get the recognition, acha lagta hai. Thank you so much. And of course, I wouldn't be here if Rotary was not there. Rotary Blood Bank, New Delhi, Faridabad, Noida, and also Gurgaon. So all of these blood banks are having their transfusion centers, not all of them, are having their transfusion centers, and we are trying to do our little bit and trying to help the thalassemics wherever it's needed. So Anthony, also my president is here today. Please, can I ask? Okay.
Would you like me to call her just now?
Yes, please.
Okay,
yes,
so I invite Ms. Deepa Bajaj and Ms. Natasha Chopra as well, please, as we call them Friends of Thalassemics India.
That's right. And I would just like to say that सिर्फ हंगामा खड़ा करना मेरा मकसद नहीं, सिर्फ हंगामा खड़ा करना मेरा मकसद नहीं, मेरी कोशिश है कि ये सूरत बदलनी चाहिए. मेरे सीने में नहीं तो तेरे सीने में सही, वो कहीं भी आग, लेकिन आग जलनी चाहिए. Thank you so much everyone. और मैं देख रही हूँ सब में आग लगी हुई है. So please, let's keep going and we will win. And congratulations to all of you. Thank you so much, Shobha ma'am. Thank you so much. I love you so much. Thank you.
I've been brought here. I wasn't quite expecting it, but now that I'm here, I would just like to thank so many people. Shri Rajinder Pal Gautam ji, thank you so much for honoring us. Of course, this is all due to Shobha ji, and thank you, sir, and thank you. Well, you know, there's a saying in Shakespeare, it says, the power of mercy is twice blessed. Well, I have to say, in this case, we are very blessed, क्योंकि जो honor देने वाला है और जो लेने वाला है, दोनों हमारे club के members हैं. So Rotary Club Delhi Safdarjung is very much in the limelight here as well. और जो शोभा मैडम हैं, ये बहुत ही different hats पहनती हैं. So apart from thalassemia chairperson, Rotary में भी बहुत ज़्यादा active हैं, and honestly, we could not do without her. She has been a pillar of support for us all. और जो काम यहाँ पे हो रहा है, मैं जो awards के बारे में सुन रही हूँ, जो ये doctors काम कर रहे हैं, really, you know, a heartfelt thanks from every mother who will really bless you and blesses you for all the good work that is being done. And thank you so much. And thank you, Tajinder, for being I call her the thalassemia warrior. Because really, in लोगों ने बहुत ज़्यादा selflessly schools में जाके, internet पे, COVID में, हर जगह में जाके इन्होंने बहुत काम किया है to make that awareness happen. And thank you, Deepa ji. Thank you so much, everyone.
Sorry. My apologies. Okay, may I now, and thank you so much, ma'am. May I now invite Miss Libya, I don't want to mispronounce the surname, ma'am. So, from DXC, head of CSR at DXC in Noida. DXC supported the purchase of 2 blood donation vehicles at the Indian Red Cross Society. Let's hear it for them, come on.
Well, you know, I'm very proud to say that here we have many CSR partners, but some CSR partners want to remain silent. They don't want to come here and to be talked about. But here we have one partner with us, and with lot of persuasion, I was able to invite her. She was also not ready to come, because these are the people who work selflessly, who donate selflessly. But here we have today from DXC, and the money that they gave us 2 years back, we purchased 2 blood donation vans and donated further to Indian Red Cross Society Blood Bank. And with their help, we have been able, you know, to surpass these COVID difficult times, and a number of huge blood donation camps took. So a great thanks to you, and we hope that this support will continue in the coming years as well.
Thank you very much for such nice words, and my greetings to everyone. First of all, I would say, after listening everybody's effort, it's a bit embarrassing, because being from an IT industry, all we do is give the financial support. But of course, Mrs. Shobha Tuli, she was very, very passionate about, her work in thalassemia. When she came, the kind of persuasion, the kind of passion that she had, that kind of convinced us to extend our support. As I said, the only financial support is what we can do. And I really congratulate and hats off to her for her passion in this field. It's not a very easy thing. So, and I wish you all the best, so that we have zero thalassemia patient in India soon with your effort. And I wish you all the best, and it's an honor to be here. Thank you very much.
Thank you, ma'am. So may I now invite our next CSR support partner, Ms. Sakshi from Akron. They have been helping our thalassemia patients, especially the underprivileged ones, since 2017. She's here. Yeah. May I now invite Mr. Ravi Mittal from Life Savers. He is the president of Life Savers Blood Donors Group, has been helping Thalassemia India by holding blood donation camp for the last 2 years. Thank you, sir. Please hold the mic. Yeah, absolutely, because then on the platform they can't hear what you're saying.
Thank you so much, ma'am. Thank you so much.
May I now invite a lady who's absolutely an inspiration for a lot of us, and I think we need more people like her. Miss Aditi Sunil Balan. She's a homemaker, but she has been helping the cause of thalassemia by holding blood donation camps for thalassemia patients and for Thalassemia India. Thank you so much, Aditi, for this.
Yeah, microphone is right. I want to thank Thalassemia India for this golden platform of an opportunity to help, to allow us to contribute to the lives of these beautiful children. The moment I was informed about this cause 2.5 years back, something just moved inside. And today, while I'm here, I want to thank Shobha ma'am, Gagan ma'am, Dr. Bose for guiding us in starting this initiative in Gurgaon, and we want to take it forward to many, many milestones. However, I cannot do any of this alone, and there is a small core team who is present here. If I may be allowed to get them on the stage to receive this on behalf of all of us, ma'am.
Sure.
Can I have Mr. Balan, Mr. Sunil Balan, Gyanendra Gaurji, Master Adidev, and from Thalassemia India, can I have Swati and Rishabh to please be on stage? You guys have been really, really, really a big support.
May I now invite Dr. Rajesh Yadav from Kasturba Hospital. He's here, right? Head of Thalassemia Unit at the Kasturba Hospital. Thank you, Dr. Saab. Let's hear it for Dr. Saab. Come on. Is it okay? Tuli ma'am, please photo के लिए आ जाइए. I now invite, on behalf of Bhavna Arora ji from the Cub Welfare Foundation, they have been doing amazing work for thalassemia patients and have been supporting our children through whatever the period, whenever we have reached out to them for blood, for sponsorship, for adopting a child, they have done it. So Mr. Vivek Jain on behalf of Cub Welfare Foundation. Thank you, sir. And now I invite one of our most favorites, especially for all of us who go to Sir Gangaram Hospital, from the Gangaram Blood Bank, one figure that's been consistently there for us for over the years, Dr. Kamini Khullan. Come on, everybody. She is our one epitome in the Gangaram Blood Bank and has stood up for our children right through the lockdown, through every period of our lives. Thank you so much, Dr. Kamini. Yeah, sure. Of course, right here. Okay, here.
Thank you very much, Gagan and ma'am and sir, for giving this opportunity, recognizing Gangaram has been doing his work. I have been associated with it for almost 15, 16 years, working in the blood bank itself. And Dr. Khanna has always been with us, working as a team, we working as a team with him. I just want to say that of all the pillars that sir you talked about, the best thing that you mentioned was the Center of Excellence, which needs not only the awareness about the prevention, but the awareness about the hemovigilance part of the blood. The safety which Madam Neelam Dhingra talked about, we should definitely look into that awareness with regard to the hemovigilance part, where the safety with respect to the transfusion quality as well as at the user end is also taken care of. Thank you very much.
Before I reach out to our actual genuine caregivers, when I say actual genuine, because they are the ones that are holding our children's hands in their hands, I would just like to definitely acknowledge IOP and AAGD, because we need this collective support to be able to achieve and accomplish what we have set out to do. Care for our children as well as awareness and prevention of thalassemia. So now I move on to the next part of our felicitation. May I invite all our sisters over here, please. I will just name them so we can just hurry up. Sister Meena from Hindu Rao Hospital. Sister Meena and Sister Poonam, please, from Hindu Rao Hospital. May I invite from RML, Sister Harjeet Kaur. Sister Harjeet, is she here? Hanji, from RML Hospital. Then from St. Stephen's, may I invite Sister Pramila. Sister Pramila from St. Stephen's Hospital. From Sir Gangaram Hospital, Sister Siji Moore Matthews, Sister Shiny Joy. Sister Soumya James.
Actually,
सभी को देख के आई थिंक जॉइंट ग्रुप फोटो करते हैं हाँ देन फ्रॉम अपोलो हॉस्पिटल सिस्टर पिंकी एंड सिस्टर अश्वती
सो प्लीज जोरदार तालियां हमारी सभी सिस्टर्स के लिए. इनके बिना हमारा ब्लड ट्रांसफ्यूजन थैलेसीमिया सेंटर नहीं चल सकता.
एनडीएमसी से सिस्टर नीरज आई है. आई हैव जस्ट बीन टोल्ड प्लीज आप भी आ जाइए स्टेज पे. Our children trust them more than they trust us. इतना जरूर कह सकती हूँ मैं. तुली मैम आप मानोगे जब कहा जाता है कि ये हमारे बच्चों की रग रग जानती हैं. Isn't it?
डॉक्टर पंकज गर्ग IAP.
सबको मेरा नमस्कार. यहाँ पर जो भी प्रेजेंट सर मैडम सबको मैं धन्यवाद करना चाहती हूँ. मैं फर्स्ट टाइम आई हूँ यहाँ पर और मैं कुछ फ्यू वर्ड्स कहना चाहती हूँ. जब मेरे यहाँ RML में थैलेसीमिया का डिपार्टमेंट खोला गया था तब मैं वहीं पे प्रेजेंट थी और मैंने ही उसको डेकोरेट किया था और उसी टाइम 8 बच्चे एक साथ मेरे पास आए थे और मैंने बहुत उनका वेलकम किया था. जो भी टीम बाहर से फॉरेन से आई थी उन्होंने भी हम लोगों को बहुत थैंक्स किया और हम लोगों ने उसका डेकोरेट जो किया पूरे हैंड से बना के फूल वगैरह बना के उसको डेकोरेट किया था. और बहुत उन लोगों को अच्छा लगा। और उस टाइम हमारे डॉक्टर सुपरिटेंडेंट सीपी सिंह थे, उन्होंने मेरा बहुत वेलकम किया और अपना पेन निकाल के मेरे हाथ में दिया और मुझे बहुत अच्छा लगा। फर्स्ट प्रेजेंट था वो मेरे लिए, तो बहुत ही अच्छा था वो। और उसके थैलेसीमियास के लिए मैं जो है ब्लड कैंप्स भी करती हूँ, पार्ट टाइम में ब्लड कैंप्स भी लगाती हूँ, साल में 2 कैंप्स मैं जरूर लगाती हूँ थैलेसीमिया के लिए स्पेशली। थैंक यू। अभी भी मैं थैलेसीमिया, मेरे पास इमरजेंसी में पेशेंट्स आते हैं। धन्यवाद।
Thank you. I invite Dr. Pankaj Garg from IAP. Please come, sir. एक मिनट। Dr. Pankaj Garg, please.
कल सुबह भी और शाम को भी।
Thank you very much, sir. And I request Mrs. Tuli to just say a few words and then we can sit down.
सर, मंत्री जी, मेरी 2 मिनट आपसे दरख्वास्त है। जैसे मैंने कहा कि हमारी एक बहुत वैल्यूएबल पार्टनर हैं NHM, जो हेल्थ मिनिस्ट्री में मैडम विनीता श्रीवास्तव जी, उन्होंने दूसरी मीटिंग करनी है। अब वो मोटा में है, मिनिस्ट्री ऑफ ट्राइबल अफेयर्स में। वो कुछ शब्द कहना चाहते हैं और उनकी स्पेशल रिक्वेस्ट है कि मैं दिल्ली के लिए भी कुछ बोलना चाहती हूँ, तो आप मेक श्योर करना कि मंत्री जी 5 मिनट के लिए और रुक जाएं। सो विनीता जी प्लीज।
नमस्कार माननीय मंत्री महोदय। माननीय मंत्री महोदय,
विनीता, आपने वीडियो नहीं ऑन किया। विनीता, वी कांट सी यू। We can't see you. Can you hear us?
Vinita ma'am, please unmute yourself.
Vinita? Madam Vinita, please unmute yourself.
Just a minute, please, just a minute. पता नहीं कुछ प्रॉब्लम आ रही है, तो स्क्रीन के बिना ही कोई इशू नहीं। आई कैन स्टार्ट। हाँ नहीं, मैं बस करती हूँ। माननीय मंत्री महोदय, आवाज आ रही है आपको मैडम? कैन यू ऑल हियर मी?
Ma'am, we can hear you. Please start your video.
Video is not working actually. So let it be audio only, no issues.
माननीय मंत्री महोदय, कैन यू ऑल हियर मी? आवाज आ रही है आपको?
आवाज आ रही है विनीता जी?
अच्छा, थैंक यू सो मच। सो माननीय मंत्री महोदय, चोपड़ा जी, शोभा तुली जी, डॉक्टर खन्ना, Mr. Harsh Mangla, I would like to remind, I just saw a presentation for Andrula. Then I would also like to thank Dr. Neelam Dhingra. So all of you, you all are welcome on behalf of Ministry of Tribal Affairs. Also, I should say thank you all of you to give me this opportunity to speak on this. माननीय मंत्री जी, आपसे मेरी पहले भी मुलाकात हुई थी और डिसेबिलिटी के विषय में जो आपने कार्य किए हैं वो अपने आप में बहुत सराहनीय हैं। और शोभा तुली जी और दीपक चोपड़ा जी के साथ जो समन्वय होकर जो कार्य योजना बनाई गई दिल्ली सरकार के लिए, वो बहुत ही सराहनीय है। बट अब समय आ गया है कि हम प्रिवेंशन पे बहुत सारा काम कर सकें, और बिना आपके सहयोग के मैं मानती हूँ कि हर स्टेट, बिकॉज हेल्थ इज अ स्टेट सब्जेक्ट, इट इज ऑलवेज सेड दैट हेल्थ इज अ स्टेट सब्जेक्ट, आपके सहयोग के बिना ये कार्य संभव नहीं हो पाएगा। आज प्रिवेंशन की बात कर रहे हैं, मैंने सीमा कपूर जी को भी सुना, उन्होंने कहा कि HPLC सबके लिए संभव हो सके तो बहुत अच्छा है। बट जहाँ तक हमारा सरकारी तौर पे और गवर्नमेंट की योजनाओं के ऊपर अगर मूलभूत रूप से सोचा जाए तो CBC देखना बहुत आवश्यक है, और CBC के जरिए हम अगर उसमें MCV MCH कम आता है तो हम लोग उस कार्य योजना पर काम करना चाहिए, तब हम HPLC पे जा सके, जिससे हमारी लिमिटेड रिसोर्सेज में भी हम अपने कार्य पूरे कर सके। भारत जिसमें अनेकों बीमारियों का समाधान अभी भी खोजना बाकी है, थैलेसीमिया के लिए काफी हद तक समाधान खोजे जा चुके हैं। बोन मैरो ट्रांसप्लांट, जिसकी विषय में जानकारी मिस्टर हर्ष मंगला ने भी दी, डायरेक्टर NHM ने, तो ये कार्य योजना थैलेसीमिया बाल सेवा योजना कोल इंडिया के तहत हम लोग ने शुरू की थी। शोभा तुली जी उसमें बहुत काफी सहयोग रूप से काम किया है। उसी तरह की संयोजना को ध्यान में रखते हुए अगर हम इस तरह के बोन मैरो ट्रांसप्लांट सेंटर अपने दिल्ली सरकार में, मैं बात से दोबारा से करूंगी कि दिल्ली सरकार में ये अगर खोला जा सके, वो एक बहुत सराहनीय कदम होगा, जिसकी आवश्यकता अभी भी है और जो अभी तक हमारे यहाँ नहीं है। हमने अभी राजीव गांधी में वो कार्य शुरू किया था, PPP मोड पे जो काम कोल इंडिया के तहत शुरू हुआ, लेकिन अगर देखा जाए जो हमारे और अस्पताल हैं दिल्ली के, वहाँ पे ये आवश्यक होना है। और ऐसा नहीं है कि हमारे पास हेमेटोलॉजिस्ट नहीं है, हमारे पास हेमेटोलॉजिस्ट हैं, अच्छे जानकार हैं, जिनकी वजह से ये कार्य शुरू किया जा सकता है। तो सरकारी अस्पताल में इस निश्चित रूप से इस सुविधा को प्रदान करना, प्रिवेंशन पे काम करना। जहां तक रजिस्ट्री की बात है, रजिस्ट्री तभी संभव हो पाएगी जब हम स्क्रीनिंग कर पाएंगे। तो CBC के जरिए स्क्रीन नजर रखते हुए मेरी आपसे एक ही गुजारिश है कि कम से कम ये 3-4 पॉइंट्स जो बहुत इंपॉर्टेंट है दिल्ली सरकार द्वारा किए जा सकते हैं। और मेरी पहले भी एक बार माननीय मंत्री जी सत्येंद्र जैन सर से 2-3-4 बार मुलाकात हो चुकी है, जिसमें ये संज्ञान में लिया जा चुका है। तो केवल अगर आपका जो समन्वय वाले काम में अगर कन्वर्जेंस की बात करें विद 2 डिपार्टमेंट्स, इट इज इम्पोर्टेंट दैट वी स्टार्ट विद द प्रिवेंशन विद CBC at least, and then to HPLC in tertiary care, stem cell transplants in the most tertiary care hospitals, and thirdly, which is very important, is awareness which should be done in PPP mode with the definitely with the organizations. बहुत important है कि ये केवल जिस तरह की जो ये संस्थाएं हैं, ये ऑर्गेनाइजेशन का काम जितना बेहतर तरीके से कर सकती है, शायद सरकार उतने मध्य रूप में नहीं कर सकती है। ये मैं खुद सरकार में रह के इस बात को कह रही हूँ, क्योंकि अवेयरनेस की जिस तरह की मानसिकता होना चाहिए, पेशेंट्स ग्रुप है, ये पेशेंट्स ग्रुप उस दर्द को समझते हुए उस तरह के कारगर योजनाएं बेहतर रूप में बना सकते हैं। तो जो आज की तारीख में दिल्ली सरकार को काम करना, मतलब मेरी एक गुजारिश है दिल्ली सरकार से कि कम से कम इन योजनाओं को एक नया रूप देते हुए अनीमिया मुक्त भारत प्रोग्राम में, चाहे NCD प्रोग्राम में, जहां आपको उचित लगे, गुजारिश है कि इसको देखते हुए उसको अनुरूप कार्य किया जाए। अगर एंटीनेटल स्क्रीनिंग पे बात करनी है तो RCH प्रोग्राम के अंडर इसको लेना ही पड़ेगा, अदरवाइज ये प्रोग्राम सक्सेसफुल नहीं हो पाएंगे। इन्हीं सब शब्दों के साथ मैं फिर से बहुत धन्यवाद देना चाहती हूँ सभी को, क्योंकि सबने बहुत अच्छे से इस कार्यक्रम में बहुत अच्छे से भागीदारी की है। और इस भागीदारी का ही महत्व है कि आज की तारीख में हम लोग कुछ कार्य कर सके हैं। मिसेस तूली जो है मुझे अपने सहयोगी के रूप में हमेशा मिली हैं और एक मार्ग निर्देशक के रूप में भी मिली हैं कि काफ़ी उन्होंने मुझे समस्याओं से अवगत कराया है कि किस तरह की समस्याएं हमारी दिल्ली में हैं। तो उन्हीं समस्याओं को निदान करते हुए मैं आपसे यही गुजारिश दी जाए और अगर आपके बेसिकली संज्ञान में होते हुए ये काम होगा तो शायद कन्वर्जेंस का एक नया रूप सामने आ पाएगा। इन्हीं सब शब्दों के साथ मैं अपनी वाणी को विराम देती हूँ। बहुत बहुत धन्यवाद। मेरी एक बहुत इम्पोर्टेंट मीटिंग चल रही थी, मैं उसके बीच से निकल के आई हूँ क्योंकि ये सारे जेएस को लेके एक नया कार्य योजना शुरू करना चाह रहे हैं जिसकी शायद मूलभूत प्रतिक्रियाएं पूरे देश में दिखाई देंगी, जो सही तरीके से काम करने का तरीका होगा। तो आप सबको बहुत बहुत धन्यवाद और आप सबके से बहुत नम्र निवेदन कि आप लोग थैलेसीमिया के लिए जो जुड़े हैं उसमें हमेशा कार्य योजना बनाते रहें और आगे तरीके से समन्वय रूप में इस चीज़ को आगे ले जाएं। थैंक यू सो मच।
So thank you very much. Thank you Dr. Vinita Srivastav. And I'm sure मंत्री जी ने सुना थोड़ा सा डिस्टर्बेंस था ऑडियो का, वो तो आई गेस पंखा चल रहा है सबके वजह से। बट थैंक यू वेरी मच सर। और अब हम नीचे आ सकते हैं, बट उससे पहले डॉक्टर अल्फा माथुर कुछ कहना चाह रही थी, तो just for 2 minutes सर।
I just wanted to share कि हम अपने एडल्ट्स थैलेसेमिक्स को देख के खुश होते हैं। I would like to share कि हमारे 5 बच्चे बोन मैरो ट्रांसप्लांट, हाँ नहीं, मैं जो अभी विनीता श्रीवास्तव जी कह रही थी तो मैं शेयर करना चाहूँगी। आई एम रियली हैप्पी टू से कि हमारे 5 बच्चों का बोन मैरो ट्रांसप्लांट इस स्कीम के अंडर हुआ है और 6 अंडर पाइपलाइन है हमारे छोटे से यूनिट के। तो एडल्ट के पेशेंट्स को देख के खुश होने के साथ साथ इन बच्चों को जो ट्रीटमेंट हो गया, दैट इज ऑल्सो बिकॉज ऑफ दिस ओनली विल पॉसिबल।
इसके लिए हमें धन्यवाद देना है अपनी मिनिस्ट्री ऑफ हेल्थ फैमिली वेलफेयर, गवर्नमेंट ऑफ इंडिया, NHM और कोल इंडिया का, जिन्होंने ये थैलेसीमिया बाल सेवा योजना शुरू की है और हमारे बच्चों को नया जीवन दान दिया है और वो एक्स थैलेसेमिक्स बने हैं।
बिल्कुल बिल्कुल, वही मैं धन्यवाद देना चाहती हूँ।
थैंक यू डॉक्टर माथुर, थैंक यू सो मच।
एक्चुअली मैंने सुबह शुरुआत में कहा था, आप में से कई लोग उस समय नहीं थे, कि बहुत कम ऐसे सेमिनार्स या कॉन्फ्रेंसेस होती हैं जहां भारत सरकार और स्टेट गवर्नमेंट दोनों मौजूद हों। यहां भारत सरकार का एक मंत्रालय नहीं, 3 मंत्रालय मौजूद हैं, हेल्थ, ट्राइबल अफेयर्स और सोशल डिपार्टमेंट, और दिल्ली गवर्नमेंट के मंत्री स्वयं मौजूद हैं। तो जहां पर सारा कुछ, जैसे जिसको बोलते हैं त्रिवेणी संगम है, अगर वहां पर सारी नदियां आकर के मिल रही हैं तो वहां स्नान लेने का सबसे ज्यादा आनंद आता है और लाभ पहुंचता है। यहां पर केंद्र सरकार के 3 मंत्रालय, हेल्थ, ट्राइबल अफेयर्स एंड सोशल एम्पावरमेंट, और दिल्ली गवर्नमेंट के मंत्री स्वयं, तो ये अगर सिनर्जी हो जाए तो मुझे नहीं लगता है कि कम से कम दिल्ली के अंदर जो थैलेसीमिक्स हैं उनको कोई किसी भी बात की कोई शिकायत या दिक्कत आनी चाहिए। सिर्फ जरूरत इतनी है कि ये सब भाग साइलोज के माफिक ना ऑपरेट करके इंटरएक्टिव होकर के सिनर्जी क्रिएट करेंगे तो लाभ अवश्य मिलेगा। मैं अब बुलाता हूं निष्ठा मदान को, बिकॉज शी हैज टू टेक ओवर। निष्ठा, और विद ओहो, अभी एयर कॉमोडर को बुलाना है तो आप बुलाओ। कम ऑन
डॉक्टर
अमिता जी, फॉर एयर कॉमोडर टू गिव हिज एड्रेस।
थैंक यू मिस्टर चोपड़ा। एंड हम सब जो यहाँ बैठे हुए इतनी देर से इनको सुन रहे हैं, आई मीन जस्ट सी द अमाउंट ऑफ एफर्ट एंड energy and passion that has gone on to bring out the changes that we see today and we foresee in the future. मैं बस एक ही लाइन कहना चाहूंगी कि हमारे जुनून का नतीजा जरूर निकलेगा, इसी सिया समंदर से नूर निकलेगा।
हम बहुत आगे आ गए हैं, पर जो हम चाहते हैं कि हर बच्चे को वो केयर मिले जो उसे इंग्लैंड, अमेरिका, यूरोप में मिलती है, आई रियली फील कि इन द नेक्स्ट 5 years दैट विल बी पॉसिबल फॉर आवर पेशेंट्स. एंड जो प्रिवेंशन, जो हम सबका पैशन है और पिछले 2 साल से हम लगे हुए हैं, आई रियली सी इट टेकिंग शेप इन द नेक्स्ट वेरी सून इन द नियर फ्यूचर, बिकॉज आज ही उन्होंने कमिट किया. तो ये सब हमको जो हम सोच रहे थे कि शायद नहीं होगा, ये सब अब होने वाला है. So I now invite our final speaker for the day before we move to the panel discussion by TPAG, Air Commander Mr. Ranjan Mukherjee. He is the Commissioner for Persons with Disabilities, Government of NCT of Delhi, and he will give talk on disability benefits under the RPWD Act. Over to you, Mr. Mukherjee.
Honorable Minister, Sri Rajendra Pal Gautam ji, Mr. Chopra Sahab, Deepak Chopra Sahab, Thalassemia India के members, doctors, Dr. Tuli, and everyone present here. It was indeed a pleasure being here with you from the morning and learning a lot of things. I've just taken over as the Commissioner of Disability in Delhi for the last 1 year or so. Per se, thalassemic patients and their problems have come only 2 problems so far in the last 1 year in Delhi. And as Mr. Chopra was saying that here the advantage is in Delhi that we have the state government very, very concerned, Honorable Minister is very concerned, and the central government is also here. So there's care for thalassemia is much better, much superior compared to any other state in the country. So we are lucky to have a very empathetic government in Delhi and also in the center to look after this particular problem. 8th May, tomorrow is the National Day, but we are celebrating it today here. And, the theme of this year is Be Aware, Share and Care. I just wanted to insert preventive care, which is possible, and the blood test, which is called carrier genetic test, that should be done. And it is not the matching of the horoscope, which in our country we believe, it has to be matching of this blood. And if that is done, I think we will avoid birth of thalassemic children. That's very, very important, and we must come up to that level wherein instead of matching horoscope, we match the blood, especially if one knows that one is a carrier. There is a premarital screening and detection process wherein it can be matched and prevented. So pre-implementation of the genetic diagnosis can prevent thalassemia to a great extent. So bone marrow, as we have heard from doctor, that it's being done, and our minister also has confirmed that in Delhi government also we will try and get that implemented in some of the hospitals. But that's a curative, reactive method. Why not try and prevent it when it is preventable? So my appeal as a Commissioner of Disabilities here is that we must try and prevent it. And a lot has been said, and there is a panel also being there. And as I wanted to inform Madam Tuli, that as Minister also has confirmed, all the 11 hospitals you can make the disability cards, and UDID card also, various camps. I have attended 5 camps with the Honorable Minister in the last 1 month or so, wherein on the spot, that very day, inspection, checkup, and the cards were issued. So it is no more the same. It is an old thing, and besides RML and AIMS for thalassemia, GTB hospital also has been now earmarked specially for thalassemic, card distribution in Delhi. So that's a very, very proactive action taken by the Honorable Minister and the government here. And so far as my office is concerned, anything that I can do which is possible, I've got very, very good cooperative ministries. Honorable Minister is very, very caring. So I'll do whatever I can do and help in any way the patients or the parents or anyone concerned. Thank you so much.
Thank you, Mr. Mukherjee. And thanks everyone for bearing with us because we are late. We know that, but everybody gets very emotional and passionate. And sometimes then we stop looking at the clocks. And today we had decided that we will not stop anybody because jo bhi bolega, dil se bolega. So we should not break that chain of thought. We will all be okay if we run a little late. The final session, I think, perhaps is the most important because it is done by the patient advocate, patients themselves. And to do this today, I have here with me Nishtha Madan Kalra. She is working currently, she's a patient and has been the founder member of TPAG group. She's working in the development and disability sector and she's a special educator. But above all, she's a huge advocate for the rights of thalassaemic patients and क्या इनकी care होनी चाहिए. कई बार लड़ते भी हैं हम लोगों से अपना पॉइंट रखने के लिए और वो तब हमें बहुत ही अच्छा लगता है. So Nishtha, I invite you. And to chair this session, we have Dr. Renu Saxena, who will be joining us virtually. Dr. Renu has been a teacher and mentor to so many hematologists. She's not here? Okay. Okay. So Dr. Renu would not be able to join us, so I hand over to Nishtha to invite our panelists and then take forward the session. This will be the final session for today, and but it is very important that we listen to what the questions the patient and patient advocates have.
Very good afternoon, everyone. Thank you, Dr. Amita, for such a gentle, I would say, introduction. And I would like to thank Thalassemia India for giving us the opportunity to hold this panel discussion. Moving ahead, I would like to introduce Thalassemia Patients Advocacy Group, as we call it, TPAG. It's a group of adult thalassemia patients that was set up in 2017 by Thalassemia India. This was done in order to protect the overall interest of thalassemics and prevent thalassemia. TPAG has representatives in all 4 zones of India, and therefore it becomes extremely interesting to interact with the panel to find out the status of various aspects, domains, which are related to thalassemia across states and domain. So, therefore, I would now like to invite Dr. Pankaj Garg, who is present with us currently. He is Secretary, IAP, Delhi. Dr. Madhvi Gupta, AOGD, Director, Professor, Obs and Gynae, Maulana Azad Medical College, Delhi. Please welcome her with a round of applause. And Dr. Pankaj Garg, please join us on stage. Along with them, we have 2 special guests who are also connected with us with the faculty link. So, Dr. Rajiv Bansal, he's the HOD, MD Pediatrics, FIAP, SDM Hospital, Jaipur, Rajasthan, and Dr. Smita Mahapatra, Associate Professor, State Nodal Officer, Department of Transfusion Medicine, SCB, MCH, Cuttack, Odisha. So I welcome all the panelists. So, sir and ma'am, since the time is less and there's a little crunch, so I request you to be brief with your answers, your statements and opinions. And I also request the audience over here, if you wish to ask any specific question, you can forward your question to Dr. Khanna. We can take that up. So, first of all, I would like to hold discussion with Dr. Rajiv Bansal, who's with us online. So, Rajiv Bansal, sir, doctor, can you hear me?
Yeah, good afternoon. Good afternoon, everyone, and thank you, Mr. Stooley and Thalassemia India for giving me this opportunity. आपका बहुत-बहुत धन्यवाद और आप सब लोगों का स्वागत है इस मीटिंग में.
Thank you, sir, for joining us. Before I start interaction with Dr. Rajiv, I would like to request all the audience members that please don't leave the event before taking the lunch, because it will be served after the event gets over. So moving ahead, I have been, Dr. Rajiv, I have been given to understand that 3,000 patients with thalassemia have been registered at Rajasthan, and all the patients receive free of cost treatment, including Asundra and Olaptips, which is relatively expensive drugs. So can you please elaborate on steps taken by Rajasthan government to make this possible, and how can other states also implement the similar model in order to support this practice?
इतना मुझे ध्यान आता है या याद आता है 2011, आई थिंक हिंदी विल बी बेटर फॉर एवरीवन टू अंडरस्टैंड. सो जितना मेरे को ध्यान आता है 2011 के अंदर राजस्थान गवर्नमेंट में बीपीएल सुविधा के अंतर्गत जो है फ्री मेडिसिन देना शुरू हुआ था, और उसके बाद बीपीएल को उन्होंने भामाशाह कार्ड के अंदर चेंज कर दिया, और कुछ सालों तक बीपीएल चला. तो ज्यादातर थैलेसेमिक पेशेंट्स वर एनरोल्ड एज बीपीएल पेशेंट्स, तो दैट बिलो पॉवर्टी लाइन. उसके बाद उन्होंने उसको भामाशाह कार्ड में कन्वर्ट किया, और उस भामाशाह कार्ड के अंदर से जो है दवाइयाँ और बाकी जो भी सुविधाएं उन बच्चों को चाहिए होती थी वो देना शुरू कर दिया. अभी लेटली भामाशाह कार्ड को खत्म करके पिछले 2-3 साल के अंदर जन आधार कार्ड को लागू किया गया है राजस्थान के अंदर, और इसके द्वारा जन आधार कार्ड के अंतर्गत अब राजस्थान के सभी बच्चों को ज़्यादातर दवाइयाँ फ्री ऑफ कॉस्ट, ज़्यादातर का मतलब सारी दवाइयाँ फ्री ऑफ कॉस्ट. मैं तो एक प्राइवेट सेक्टर में काम करता हूँ, और प्राइवेट सेक्टर के भी मेरे मरीजों को मैं सरकारी अस्पताल में भेज के सारी दवाइयाँ उनको फ्री मिलती हैं. सो आई एम एक्सट्रीमली थैंकफुल टू गवर्नमेंट ऑफ राजस्थान फॉर गिविंग फ्री मेडिसिन टू दीज पेशेंट. साथ में आई एम एक्सट्रीमली थैंकफुल टू विनीता श्रीवास्तव जी, जिनके सहयोग से नेशनल हेल्थ मिशन द्वारा राजस्थान के थैलेसेमिक रोगियों के लिए सभी दवाइयाँ और ल्यूकोसाइड फिल्टर सरकारी अस्पतालों में निःशुल्क उपलब्ध हो रहा था. वो प्राइवेट सेक्टर में नहीं आ रहा था, उनको फिल्टर वहीं मिल रहे थे, और डेफ्रेसोरॉक, एफसीटी, ओलेप्टिस भी उन सरकारी अस्पतालों में निःशुल्क मिल रही थी. एंड वी हैव हर्ड एनआरआई secretary and Vinita ji, and I think this will go a long way of helping all our thalassemics all over India to get into this free medication. Thank you.
Thank you so much, sir. In order to share your success story, we would also like to know कि राजस्थान बहुत अच्छा काम कर रहा है ट्रीटमेंट एंड मैनेजमेंट ऑफ थैलेसीमिया में. क्या चाइल्ड बर्थ विद थैलेसीमिया को भी कंट्रोल करने में आप सक्षम रहे हैं?
जो प्रिवेंशन की स्ट्रैटेजी है, जैसे अभी मेरे प्रीवियस स्पीकर्स बोल रहे थे, तो जो हमने अपने हॉस्पिटल में शुरू किया है, मैं एक प्राइवेट हॉस्पिटल संतोखबा दुर्लभ जी अस्पताल में काम करता हूं, और हमारे यहाँ एक स्कीम हमने काफ़ी सालों पहले शुरू की थी, जो फिक्की से भी हम लोगों को उसके अंदर अवार्ड मिला. एक प्रोजेक्ट का नाम शुरू किया है प्रयत्न, और उसके अंदर हमारे यहाँ जितने भी वॉलंटरी डोनर्स आते हैं, ब्लड डोनर्स, और जो भी हमारे ओपीडीज में भी पेशेंट्स आते हैं, उन सबका हम सीबीसी स्क्रीनिंग करते हैं, और उन सीबीसी स्क्रीन से हमने सॉफ्टवेयर बना रखा है, उसके अंदर उस सॉफ्टवेयर से डाल के जो पैरामीटर्स आते हैं उनसे हम असेस कर लेते हैं कि किन पेशेंट्स को हीमोग्लोबिन इलेक्ट्रोफोरेसिस चाहिए, और फिर वो हीमोग्लोबिन इलेक्ट्रोफोरेसिस हम फ्री ऑफ चार्ज हमारा हॉस्पिटल उनको करता है. एंड वी हैव डिटेक्टेड so many patients with thalassemia minor, and then we have given them genetic counseling, तो उनकी करते हैं. राजस्थान में करीब 4 to 4.5% का थैलेसीमिया माइनर का इंसिडेंस है, तो एक ये इम्पोर्टेंट चीज़ है. दूसरी चीज़, वॉलेंट्री ब्लड डोनेशन राजस्थान में, स्पेशली जयपुर में, स्पेशली संतोखबा दुर्लभ जी में बहुत ही अग्रेसिवली प्रमोट किया जाता है. दैट इज़ अनदर बेनिफिशियल थिंग फॉर, क्योंकि जैसे मिसेस तूली बता रही थी कि वैन, तो हमारे हॉस्पिटल में ऑलरेडी जैसे कोविड टाइम में हम लोगों ने वैन्स ले लेके जब जिस टाइम बहुत ही डिफिकल्ट था ब्लड प्रोक्योर करना, तो हॉस्पिटल की वैन्स दूर दूर तक जा जा के ब्लड प्रोक्योर करके लोगों को मोटिवेट करके लेके आई। और तीसरी चीज, हमारा हॉस्पिटल खुद फ्री सर्विसेज देता है, प्राइवेट हॉस्पिटल होने के बावजूद भी, जहाँ पे ऑलमोस्ट 100 बच्चों को हम लोग फ्री सर्विसेज दे रहे हैं ट्रांसफ्यूशन के माध्यम से। तो ये कुछ चीजें हैं जो कि राजस्थान में और बहुत सारे और दूसरे हॉस्पिटल्स में भी ये सुविधाएं दी जा रही। और जेके लॉन जैसे जो हमारा प्रीमियर इंस्टीट्यूट है सरकारी अस्पताल का, उसके अंदर एक सेपरेट वार्ड है और एडल्ट वार्ड भी है एसएमएस के अंदर, जहाँ पे एडल्ट थैलेसेमिक्स को ब्लड ट्रांसफ्यूजन दिया जाता है, और एक नोडल ऑफिसर है जो उनकी दवाइयों का ध्यान रखता है।
Thank you so much, sir. I would say that Rajasthan is doing really exceptional work in terms of treatment and prevention of thalassemia.
हाँ, एक चीज और मैं कहना चाहता हूँ, जो राजस्थान यूनिवर्सिटी के अंदर हमारे यहाँ एडमिशन होता है, स्पेशली एमफिल के अंदर, उसके लिए आपको थैलेसीमिया की रिपोर्ट लेकर, हीमोग्लोबिन इलेक्ट्रोफोरेसिस की रिपोर्ट लेके आनी होती है, तभी आपका एडमिशन होता है।
I would say this one step is the key factor in order to prevent thalassemia, क्योंकि अगर हम adults को timely screen करके counsel कर सकते हैं, we can certainly prevent thalassemia childbirth. And इसी की वजह से probably हमारा जो vision है thalassemia free India वो possible हो सकेगा. So thank you, sir, for sharing this initiative as well. Next, I would like to move upon, and I would like to call upon Dr. Smita Mahapatra. She's Associate Professor, as I have told you. She's State Nodal Officer, Department of Transfusion, Medicine, SCB, MCH, and Cuttack, Odisha. So, ma'am, are you here? Dr. Smita?
Yeah, good afternoon. Good afternoon, everyone. Am I audible?
Yes, ma'am.
Am I visible?
Yes, ma'am, you are audible. Thank you for joining us today.
Thank you.
We would like to talk about Odisha and Odisha's model. Now, everybody here knows that Odisha government has given a mandate on NAT-tested blood for all thalassemia patients. So this is a big achievement, and you could make it possible. So I would want to know that how your journey has been, and what were your challenges, how have you overcome them, and how can other states also implement the same model as it is being implemented in Odisha?
I have prepared a presentation. Would like to share it just in a nutshell, and then will be. May I?
Yes, ma'am. I hope it is brief. Just
yeah, it will be finished in 5 minutes. Yeah.
Please go ahead, ma'am.
Is it visible?
Yes, ma'am, it's visible over here.
Yeah. Okay, thanks a lot. So first is that stating of the state of Odisha. In the state of Odisha, with a population of around 4 crores. So we are a small state, but still we have around 85 blood centers, with being the 35. Is it visible? Yeah. So there are 55 government blood centers and 30 private blood centers, and along with 42 blood storage centers. So out of this 85 blood centers, so we have 25 numbers of blood component separation unit functional, and around 30 more blood component separation unit are in pipeline with genset backup of capacity 100 kV. In our state, the voluntary blood collection is around 72%, but we have aimed at 100% blood issued to the thalassemia patient without exchange, even during this COVID pandemic. The refreshment, the total refreshment after the blood donation, he receives around ₹50, and ₹60 is being donated for all our organizers to promote the voluntary blood donation. E-blood banking has been implemented in all the government blood centers with hemovigilance reporting to National Biologics at Noida. The external quality assurance is being conducted with the CMC Vellore and the State Referral Immunohematology Laboratory, which is the postgraduate Department of Transfusion Medicine and Blood Center, SCVMCH, Cuttack, where I am the head of the department. In this, our immunohematology lab, we all do the antibody screening, identification, the antigen negative blood being issued to all the thalassemic patients. So the patients, the thalassemia patient requiring blood transfusion in our states are around 4,240. Yeah.
Sorry to interrupt. Yeah. We are actually exceeded our time today. So I request you to kindly stick to the main point and please share how have you made this expensive treatment possible?
Yeah, ma'am. All this, yeah, ma'am.
What is the learning that other states can also gain from this?
Ma'am, I understand, but I hadn't got any clearance from the moderator or anything. Just give me two minutes more. I'll be briefing and I'll come back to the point what you have raised, because whatever Ms. Tulli had requested that from the state of Odisha, all the initiative regarding the thalassemia care, it's not only on the NAC itself. So just give me 2 minutes more. So we are providing 60,000 lipo filters that already has been discussed with Ms. Seema Kapoor. The lipo reduced blood component should be given to the thalassemia patient. So this the slides what you are, because just I came to now that you are focusing on the NAC thing, that actually if you would have got a glimpse of it, then I would have focused on it also. The NAC testing facility in our state, it has been the blood has been provided free of cost. So we are having all the routine ELISA seronegative samples. They are being additionally screened with the NAC thing. So around 11 government blood centers across the states are having this NAC facility with the automation of blood grouping and cross matching in 13 blood centers.
Dr. Smita, sorry, I am bothering you again, but we have Dr. Ranjula, who's an international expert, waiting to speak for 1 minute. So if we can just give her 1 minute, you can continue after that?
Sure.
So, Dr. Ranjula, please. I would now like to request Dr. Ranjula from TIFF to join us.
Yes, thank you very much, and I do apologize to the eminent speakers for interrupting, because what I have heard are so significant pieces of information that I'm sure there is so much going on across the subcontinent that it makes me very impressed and very hopeful that there will be final and complete improvements in the next years to come, and I look forward. I just wanted to say a big thank you to the organizers, to all the eminent speakers with whom we know each other for so many years, and I know their passion and their commitment firsthand. And I would like to express my gratefulness on behalf of Thalassemia International Federation. And let me, last but not least, thank our collaborators at Thalassemics India, Mr. Chopra, the president, but Mrs. Chuli, who has been there with me for decades. Mrs. Chuli, allow me to say a special personal, I know you don't like things like comments like these, but we feel the commitment to thank you for that. So allow me to go to participate in the Italian workshop, because there are 40 workshops around the world, and just to thank you once again. Thank you very much.
Thank you, Dr. Ranjula, for your kind words. And now, Dr. Smita, can you please wrap up within a minute or so, because we are actually very short of time.
Sure, ma'am. Ma'am, in fact, I had just done only a few slides only. So, very few, only 2 to 3 left over. So, these are the things, ma'am. So basically, what we do, that safe blood has been provided free of cost since 2019 Even the travel allowance of rupees 500 per thalassemic patient requiring transfusion per month is being provided since 2018. There's a free diagnostic service through Nidan scheme. Even the Deferox, the iron chelator is being provided without any cost. Even the hepatitis B and C vaccination for all the thalassemic patient without cost in the pipeline, and there is IC awareness. So the government of Odisha, this is the most important point which I would like to highlight, that has signed the MOU with CMC Vellore for implementation of this control of this sickle cell and thalassemic disease in the state of Odisha. So it has been implemented in 15 districts and it will be expanded in 30 districts with a pre-marriage counseling, antenatal coordinate sampling with MTP, and after birth, the diagnosis, the treatment, the prevention of the disability, everything is being taken care. And lastly, the ongoing thing, like the government is providing the blood bags, the kits, consumable equipment, everything to the blood center to optimize the uniformity in maintaining the quality, cost, and timely requirement. So the 3 daycare centers have been opened in the 3 district hospital in the blood disorder patient, and the 9 blood collection vans have been supplied. So, and has initiated for the 2 more blood collection vans where we can collect from the donors. Even during the COVID pandemic, free and safe blood has been issued to all the thalassemic without any interruption, with a 6 number of apheresis machine and TIA machine have been provided to the government blood center for provision of the convalescent plasma. And this was all without cost, with a therapeutic red cell exchange, plasma exchange being performed in ACV, that is without also, with a goal of that budget. The government of Odisha has provided around 35 crores towards strengthening of the blood services in the state of Odisha, with a motto to supply safe blood from voluntary blood donation with proper treatment and prevention of complication in all the thalassemic patients, and that too free of cost. Thank you so much.
Thank you, Doctor. And what I realized is that Odisha followed a multi-pronged approach, because of which they could achieve what they have. So moving on, I would now like to pose some questions to Dr. Madhvi Gupta. Doctor is a Director Professor from Department of Obs and Gynae, Maulana Azad Medical College. So Doctor, you know thalassemia is preventable if thalassemia screening is done in early pregnancy. The diagnosis of adult thalassemia minor people, I would not call them patients, at early age can actually lead to timely antenatal screening, which can further prevent the thalassemia births. So how do you think that we can make this practice compulsory, and what kind of awareness drives can we take up under different schemes? So please guide us on this.
Yes, you're right. Thalassemia is actually preventable if we screen. Ideally, it should be screening in adolescence for both girls and boys. But if not so, then early pregnancy. And if both the patient partners are carriers, then you do an invasive testing. So coming to these awareness, that is our organization, AOGD, has a lot of members, over 2,000 members. And most of them are aware. But the cost of HPLC, which Dr. Seema Kapoor had also mentioned, is prohibitory for many patients. Even in our hospital, which is a tertiary care, it is not available always. So as a policy, if the government at the center and every state makes it mandate free of cost available, and patients from smaller setups can be referred to bigger hospitals in their local with linkages, so that they don't have to pay and they don't have to spend time running from pillar to post and getting an investigation slip. And if that is done and the report is available in early pregnancy, so and then that should be before 14 weeks, so that invasive prenatal testing is done, and then you can be offered termination timely if the baby is affected. I think awareness and various, we can, through our association, we can make campaigns, but the policy has to be made at the level of the government.
Thank you, Doctor,
Nishta,
for highlighting the fact.
Nishta, sorry to come in between. Ma'am, we really need AOGD help here and from IAP as well. जहाँ तक हमने सुबह से हम सुन रहे हैं अवेयरनेस, प्रिवेंशन और मिनिस्ट्रीज भी आप एक तो केयर है जो हमारे एग्जिस्टिंग बच्चों के लिए है, पर आप दोनों इंस्टीट्यूशंस हमारे लिए इतने इम्पोर्टेंट हो जहाँ तक हमारी प्रिवेंशन की सवाल है। आप सोच सकते हो कि कितने बच्चे जो हैं जिनके माँ बाप नहीं अफोर्ड कर सकते हैं ट्रीटमेंट, उनको हमको खोना पड़ता है in the prime of their youth, and which is very painful for the parents. So what we request from AOGD and from IAP कि आप एक अवेयरनेस ड्राइव्स कीजिएगा, चाहे वो वर्चुअल हो चाहे फिजिकल हो, और हर मीटिंग के अंदर थैलेसीमिया की बात हो कि किस तरह से उसको प्रिवेंट कर सकते हैं। और मैम किसी तरह से हम दिल्ली सरकार से पूरी कोशिश करेंगे कि इसको एक मैंडेटरी किया जाए, पर मीनवाइल जब तक वो नहीं होता तो फॉक्सी, AOGD, IAP से हम मदद चाहेंगे कि इसको जितना भी आप इस बात को फैला सकते हो अपने इंस्टीट्यूशन की तरफ से कि फैला दीजिएगा, ताकि आपके बिना हमारी प्रिवेंशन कभी भी संभव नहीं है। चाहे कुछ भी हो जाए, चाहे हम कुछ भी कर लें, 35 साल से हम लगे हुए हैं, जो कुछ भी हम थोड़ा बहुत कर सके हैं वो बच्चों की केयर के लिए और अवेयरनेस के लिए, बट दैट इज नॉट एनफ। So we really need your support. And I think Dr. Amita also wants to add some.
No, ma'am, I just wanted to share that the Ministry of, the Health Ministry of Delhi, they are committed कि हम HPLC, because issue सारा यही घूम के हो रहा है कि NHM says कि पहले आप CBC करिए, but by the time a lady is registered, उसका CBC हो, उसको कोई एक busy OPD में देखे, the time for prevention is lost.
Yes.
तो HPLC universal के लिए they are putting everything in place before they issue a notification. But if every, the AOGD के members, अगर if at least हम Delhi से, so last 2 years we have been working कि Delhi is a small thing. Most births are in urban care. Almost every mother receives some kind of prenatal care. तो अगर कोई state या territory इसको prevent कर सकता है तो Delhi है. We can't make national policy, but at least in Delhi we can bring about a change. IAP can help, but the bigger role is with AOGD.
Yeah,
so,
prevention will come from our side.
So क्योंकि वहाँ से they said we will only issue this circular once we have all the infrastructure in place. But हमारे पार्ट पे थैलेसीमिक्स इंडिया से we are ready to launch a helpline कि कोई लेडी को प्रीनेटल आपने HPLC कर लिया, अब वो CVS के लिए कहाँ जाएगी? वो धक्के खाते रहने में, वो 15-20 हजार इकट्ठे करने में ही टाइम गुजर जाएगा। तो we are committed to make a helpline कि your patient needs, your pregnant lady needs an antenatal prenatal diagnosis, that will be arranged for her. They just need to ring on that number. We are tying up with different centers. तो हम चाह रहे थे कि आज उसको एक concrete form में announce करें, but it was a little premature. So we just want to commit that we will put everything in place. But सिर्फ आपसे जो हमें हेल्प चाहिए to kind of convey it कि अगर हम आज की डेट में VDRL हर प्रेग्नेंट लेडी का कर रहे हैं, I don't know when anybody saw syphilis last. हाँ, उसके पैसे 50 रुपए हैं and HPLC के ज्यादा है, but we will take care of the cost somehow. Mostly the government will take care and they are committed to that. तो बस वो अगर आप disseminate करवा दें कि वो जो आपका प्रेग्नेंट लेडी का वर्कअप जाता है उसमें वो आना है, बिकॉज वी फील कि ये CBC, MCV, मेंसर इंडेक्स ये तो पिछले 35 साल से बोला ही हुआ, लेकिन आर नंबर्स व्हाट रियली, मतलब वी हैव टॉक्ड अबाउट पॉजिटिविटी, बट जो चीज हमें नेगेटिव करती है, व्हेन आई जॉइन मेडिसिन वी सेड हर साल 10,000 बच्चे पैदा होते हैं, और इस साल भी जब हम अपना ब्रीफ बना रहे थे यही लाइन लिख रहे थे कि हर साल 10,000 बच्चे पैदा होते हैं.
That is most painful.
So that is what hurts us.
Yes.
What have we achieved then?
No, what, for these referrals we do for our government hospitals for high-risk obstetrics and all, there are referral linkages. So similarly, it can be done for patients who require prenatal testing. If there is a system in place where linkages can be made with the government,
we will put it in place, and it will be, if the patient needs it, and we are not going to ask कि अपना BPL card दिखाओ. If the family says I need that support should be given.
No, that is because the Thalassemia India would be doing. From the government of Delhi, we are in the process of making linkages. The government is making where only a high-risk patient will go to that area, tertiary level, what is at a primary level, secondary level. So similarly, it can be done for invasive testing also. In certain government hospitals, we have invasive testing available. So they can be referred, and it will be done free of cost.
Ma'am?
Yes.
Ma'am?
Yeah.
Sometimes,
So
you
that-
know, the pregnant women are in contact and they need this test, but it's not possible because of the cost factor or
Yes.
whatever. So what Dr. Amita is saying, we wish that we would have announced today in the morning. But what I request now is whenever you have your next meeting, AOGD meeting, and we are going to make a formal announcement कि कोई भी pregnant woman अगर उसको CVS testing करवाने के लिए मदद चाहिए, monetary मदद चाहिए, वो Thalassemics India को contact करे और हम आज की डेट से लेके 30 मार्च तक की उसकी गारंटी देंगे कि हम उसको बिल्कुल भी उसका टेस्ट करवाने में भरपूर मदद करेंगे. And I think Dr. Khanna wants.
No, I wanted to say something similar only, that this test should be, like we are doing so many tests during pregnancy. Why
Yes.
can't we do this small test?
Yes,
and prevent so many births of thalassemia?
I totally
It is
agree
our
with you.
duty to look after those thalassemics who are born already. But it is at the same time our duty to prevent births of thalassemia major.
Yes, sir.
And I think it should be made mandatory. There is no reason why it should not be made.
Sir, we can disseminate, and but in a government setup, it has to be made available to the hospital. Because as a doctor, we can write, but even for many patients, the cost is quite prohibitive, and they probably don't realize the implications.
Regarding cost, Mrs. Tuli has already explained.
That is for fetal testing.
We'll take care of
I'm
the
talking
cost.
of HPL. Even for HPLC, we are setting the process. Okay, so that will
क्योंकि
be
हम
it.
इतने सारे लोग एनजीओस गवर्नमेंट जाके कैंप्स कर रहे हैं स्कूल या कॉलेज में.
Yes.
तो वही एचपीएलसी मतलब वी नो द नंबर ऑफ बर्थ्स, वी नो वेयर दे आर हैपनिंग, ऑल दैट होमवर्क हैज बीन डन.
Okay.
वी एंड so much the government can take care, so much Red Cross can take care, so much Rotary. So we are just trying to put it together, and we'll come to you when everything is in place. But we just look forward to you getting it.
Yeah, we
executed.
are there to support you, and whatever way you just let us know, we'll
And
be.
above all, you know, I hope you are aware कि Indian Red Cross Society और Thalassemics India ने एक joint project शुरू किया है thalassemia screening and counseling के लिए. तो कोई भी आपको कोई मिले जहाँ पे वो thalassemia screening करवाना चाहते हैं, तो वो उनको Red Cross में आप भेज सकते हैं. हमारे थ्रू आएंगे तो उनकी फ्री ऑफ कॉस्ट वहाँ पे थैलेसीमिया स्क्रीनिंग भी होगी, जो कि प्रोजेक्ट 2 साल से शुरू हुआ है.
ठीक है.
मेरा भी एक
Hospital, you can send to our hospital, Gangaram, I'll get the test done free. There is no problem in getting the test done free. You have to motivate patients to go for the test. That is the main thing.
We'll do that, sir.
I've got one suggestion that all over India these days, like CBC has become a part of all, every day, day out, so many CBCs are done. It should be made mandatory that those indices being applied as compulsorily, and the patient or child should be made, or lady should be made aware that they need HPLC. So they are the real candidates for HPLC. So that could be done. And secondly, majority of the pediatricians and obstetricians are not trained to see CBC properly, to catch hold quickly, to see one quick look and you can say this is a suspected patient for thalassemia trait. So we have to make them, that awareness program has to go from both the societies actually.
डॉक्टर बंसल, अभी हैदराबाद में जो कॉन्फ्रेंस हुई थी वहाँ पे हेल्थ मिनिस्टर चीफ गेस्ट आए थे और उन्होंने डिक्लेयर कर दिया कि HbA2 जो है मैंडेटरी टेस्ट होगा. जिस दिन हमारे हाथ में वो नोटिफिकेशन आ जाएगी, we will share it with all the thalassemia NGOs across the country, and we have to work accordingly then.
Okay, so thank you. It has been really intense discussion, but very important because we know that prevention, when we talk about it, it cannot just be done without the support of AOGD. So therefore, all of us are actually requesting you to please take it up.
Yeah.
In your next meetings.
We are there. You just let us know how we can work together and we'll work out something. Yeah.
Definitely collaboration is one thing that we always look forward to. So moving ahead, Dr. Pankaj Garg. Dr. Pankaj Garg is Secretary in Indian Academy of Pediatrics, Delhi. So welcome, sir. And I would like to know that early diagnosis of thalassemia can actually influence the future treatment of overall health and the management of thalassemia as a disease. So what do you think that how can Indian Academy of Pediatrics can do best in order to actually prevent an optimal management of thalassemia? Also share your take on how the thalassemia community and the NGOs can also partner with IAP in order to make this a smoother process?
I think complete blood count is something which always make you suspect that it can be thalassemia. The only issue with most of the pediatricians is that we know that iron deficiency anemia is very common. The milk intake is very high, especially if you see in first 1 or 2 years of age. So what we are trying to do at IAP level is we are trying to do workshops in interpretation of complete blood count that will not only help in diagnosing hemoglobinopathies like thalassemia early, so many other disorders also. So IAP Delhi this year has a flagship program of technical skills at doorstep in which we are doing workshops in each part of the city. We have already done a CBC workshop in West Delhi, which was very successful, attended by 35 people, and very thoroughly all CBCs were discussed. We are doing that 4 more workshops in other parts of the Delhi also. Apart from that, the annual conference of IAP Delhi, which is the PCNI, Pediatric Conference of North India, it was done in only in 2019, and 21 it was done in Pullman, and 22 this year we are doing to do it in Ashoka Hotel. This is each year whenever we do our workshop, we have a workshop or a talk or something which is related to the interpretation of complete blood count. So in that we discuss this in very detail, that how to pick up thalassemia minor, how to pick up thalassemia major along with other hemolytic disorders, along with leukemia and other hematological disorders which can be picked up by CBC. So we can make it a regular feature. We are already moving in the right direction. We are already dealing with the issues related to thalassemia in a bigger way. Like tomorrow itself, it gives me pleasure to announce that IAP Delhi has collaborated with Dr. Khanna and Thalassemia India, and we are doing a virtual workshop tomorrow from 11 to 1, in which not only the early diagnosis of thalassemia, the issues which are common pediatricians. See, we are fortunate to have Dr. Khanna with us, but there are not many people who look after only thalassemia. Many thalassemics will come to me and other pediatricians who may not be updated on what is happening in thalassemia. So what are common issues which a common pediatrician should know about thalassemic children along with the problems, and what is update on the management. So that is tomorrow morning we are doing 11 to 1. So we are already partnering with you. We can make it more often. I absolutely acknowledge that there are many other things to look after as a IAP platform. And we do it once we know that Thalassemia Day is coming, so let us do something on thalassemia. But yes, I honestly accept that we should do it more often. Even CIAP, the Central IAP, is also collaborating with Thalassemic India, and this is another virtual workshop which is happening tomorrow evening. So the same day we are doing 2 workshops, one in morning, one in evening. But yes, we can make it more often. Thank you.
Thank you. You also touched upon one of the important aspects that thalassemia as a problem and the treatment is being taken care of by the thalassemia experts. But for their day-to-day management of thalassemia and their upcoming issues, mostly the children go to their attending pediatrics. So what is your guidance to the pediatricians and to the patients in order to manage their day-to-day treatment?
I think most pediatricians now try to maintain a file of the primary diagnosis of the patient, and then we accordingly manage the small issues which come up. Normally, if a thalassemic is on some drugs because of thalassemia management and comes to a common pediatrician who may not be an expert, there are certain things which should be very clear, that as I was discussing with Dr. Khanna also, that if a patient on Kelfer is coming to you with ulcer, if a aphthous ulcer is there in a normal busy practitioner, we always think, okay, give him B complex, give him something, some soothing Zytizel and all, it's fine. But if he is coming with thalassemia diagnosis with Kelfer, I know it can be very serious. You have to look for granulocytosis, you look for HIV and other things. So they are small, but I think after tomorrow's presentation, which we sing, then we can have some snippets which can be posted on IAP Delhi website, that if a thalassemic is coming to you with this symptom, suspect this, which is also possible. So a patient is coming to a congestive heart failure. We know that if it's otherwise child, we always think about a heart lesion, maybe a left to right shunt, maybe myocarditis, some cardiomyopathy. Thalassemia come to me with that symptom, I will suspect there is some iron overload happening. So some small symptom which we'll make with the help of Dr. Khanna, and we can post it on our website. And now media is so popular. Every day we have 8 groups of IIP Delhi along with 5 academic groups. We post a academically oriented message on them every day, which may be related to any field. So we can have some snippets which we can post on those social media also to make other pediatricians aware of common issues which can be faced by them.
Thank you, Doctor. You very well actually related to our motto today. Be aware, share and care.
Absolutely.
So your talk was completely in that line. So on this note of be aware, share and care, I would like to take I would like to conclude this panel discussion by sharing that we from Thalassemia India are up front in order to collaborate with AOGD as well as with IAP, and we would like to do our best and give our maximum support to you. And in return, we have discussed so many issues which are emerging and needs to be taken care of. We would like you to take up the same on the relevant platforms and help us make our lives better. So thank you.
Thank you so much. Thank you.
Nishtha, I want to so we have come to the end of all the medical sessions and the felicitations ceremony. And I really, before Dr. Khanna gives vote of thanks, I really want to thank Nishtha Madhan first. She has made us proud. And she is a member of the Thalassemia Patients Advocacy Group. Anuba Taneja was not able to come here because she was feeling not little better. I think she's better now. She was not feeling good. And she, along with all the members, have worked countrywide in spreading awareness about thalassemia and by joining hands with so many associations, which is incredible. We could not imagine that one day, our thalassemic children will grow up and will take up such positions and will make not only their parents proud, पर हम associations को भी अब आगे जो है वो इन्होंने हमारा अब साथ देना शुरू किया. हम इनसे सुनते हैं कि बताइए आगे क्या करना है, क्या ठीक है, क्या सही है, क्या गलत है. So they are our inspiration and they will keep guiding us and we will giving them the support, we will keep guiding them. But it is all will be possible with the help of all the expert doctors, medical professionals, hospital, blood banks, and the government, of course. Without that, nothing is impossible. So I invite Dr. Khanna now to give the formal vote of thanks.
Well, ladies and gentlemen, I have a very good feeling after today's program. I sense that with the involvement of everyone, we are crossing from one milestone to another milestone in the care and prevention of thalassemia. You must have seen the interest shown by everyone from central government, from Delhi government, and from medical field, from everywhere. So, first of all, on behalf of Thalassemia India and TPAG, I would like to express my gratitude to all esteemed guests, faculty members, and delegates for providing their presence and their contribution. We are very grateful to our chief guest, Shri Rajendra Pal Gautam, Minister of Social Welfare, Government of NCT of Delhi, for he accepted our invitation at a very short notice and he was here with us today. Our thalassemics need his support and blessings. I'm very thankful to Dr. Shri Harsh Mangla, and I hope that under his guidance we'll have the national NHM program on care and prevention of thalassemia, which will be implemented widely, because it has not reached the peripheries so far. That's what I know. Then my special thanks to Dr. Andrula Lithio. She had to go somewhere to attend some other meeting from Italy. And she's the executive director of TIF. And she has been always guiding us, motivating us, and we always value her opinion. For in every program organized by Thalassemia India, she has been always guiding. My sincere thanks to Dr. Neelam Dhingra, Dr. Seema Kapoor, Dr. Shabnam Singh, and Air Commodore Ranjan Mukherjee. He's not here, I suppose, Mr. Ranjan Mukherjee, but I will request him to make the procedure of the disability certificate for our thalassemia patients simpler, because it is still not that easy. What patients tell us, I'll request him to, if he can do it, make it a little simpler. To Mrs. Vinita Shrivastava, what should I say? A big thank you. Because our thalassemia family will always remain grateful to her for the work she has done for thalassemia during her tenure in Health Ministry. Our sincere thanks to Dr. Rajiv Bansal and Dr. Smita Mahapatra for giving their precious time and for their inputs. Thalassemia India is also thankful to Rotarian Madam Deepa Bajaj from Rotary Club of Delhi, Safdarjung, for her support. And our gratitudes to Dr. Madhvi Gupta and Dr. Pankaj Garg. And I think, seeing their enthusiasm, Madam, and your interest in thalassemia, we hope that the activities of AOGD and IAP Delhi will be more towards prevention of thalassemia. That's what we expect from you, Madam. And congratulations to all our special guests for being felicitated. Truly well-deserved honor for each one of you. Thank you for coming here, all of you. We really appreciate the logistic support extended by Narayana Health, Fresenius Kabi, and Xavier. And you will agree with me that today's program was conducted flawlessly, and it was because of Mrs. Gagandeep Singh and her showcase team. Thank you, Madam. And as is known for decades, that Mr. Deepak Chopra is our guiding light for everything to do with thalassemia. I don't know whether he is there, but always I thank him for his guidance throughout. And Mrs. Shobha Thuli, a person who is very passionate about thalassemia. She works consistently, tirelessly, and selflessly for thalassemia. I think we must give a big hand for Mrs. Shobha Thuli. Thanks, Dr. Amita, for conducting the whole program, and Nishta for beautifully conducting your panel discussion and covering so many aspects in that. And once again, I thank each and every one of you for attending this program. Thank you very much. I request everyone to proceed for lunch. I know it's late, but please join us.